Not a lot from me, except for I do believe that we're all rolling out the vaccine in very good style and progressing the whole vaccination programme very well. Just one thing, Glenn, how are we with all our team or those involved with social care? Are we really got through them?
Thank you, Chair. So, as members will be aware, Lincolnshire achieved its first national target of the first 4 cohorts in the national programme, all being offered the vaccine. We're now beginning to see those people coming through for their second jabs, which is really good news, given the proportion of older people in Lincolnshire. We are therefore disproportionately further ahead than many other parts of the country, because many more people fit in the first 4 categories. Our rate of vaccination offer and uptake for frontline practitioners is over 85%, with all frontline practitioners having been offered the vaccine, and all our homes, plus the staff, have also been offered the vaccine, with an uptake of well over 85%, which is a really good result. So thank you, Chair.
Excellent, great news. Thank you very much for that. So, okay, so we'll progress on to item 5, agenda item 5, the Adult Care and Community Wellbeing Market Position Statement 2020 to 2023. I would like to introduce the present presenters here: Gareth Madison, Service Development Manager, and Claire McNally, Project Manager, Service Development. Welcome, Gareth and Claire.
Thank you, Chairman.
Thank you, Chairman.
Chairman, would you like me to introduce the item for officers to then go through the detail?
Yes, if you'd like. And then, yeah, and then we'll comment on it afterwards.
Thank you very much indeed. So for some members, this will be the second time you have seen a market position statement on behalf of my directorate. This was brought in as a result of the Care Act 2015, which is rather pointedly, therefore, the reason why we had our first market position statement for 2015-18. All councils are expected to produce a market position statement, but I think it's fair to say that not all do. However, we believe that this is an important moment to produce a document that will help the social care market plan ahead. And colleagues have been working incredibly hard to pull together this document for you today. Councillor Bradwell has seen it and made comments, as have colleagues from our social care providers. And at that point, Chair, if you will, I'll hand over to Gareth and Claire to take you through the document.
Excellent, thank you.
Thank you, Glenn. As Glenn has mentioned there, the market development statement is a statutory requirement for local authorities following the Care Act. This is to signal the intent of Lincolnshire County Council in terms of the direction of travel policy intent, and provides key information and statistics on needs, demands and trends for adult social care. As you can see, the document is fairly substantial and also includes detail on a number of commission services. Each section is broken down into what the service is, how many people use it, and then also some of the commissioning intentions with that. It signals an opportunity to the care and support market within Lincolnshire and is intended to be used by providers to plan for the future, informing their business choices, such as investment or personnel. The document sets out what the council aims to achieve, some of the financial challenges that we face, the current service delivery, and does reference some of the complexities which have been recently encountered with COVID-19 and some of the innovations and challenges that that we've, as I say, encountered. It has market intelligence. We've worked quite closely with colleagues in the commercial team. We've worked with colleagues from Lincolnshire, and also have one-to-one meetings with all key stakeholders who do run those commission services. So it's a fairly up-to-date sense of what the adult social care service looks like right now. I think Glenn explained quite significantly, why we do need it. And have worked quite hard with colleagues to pull it all together and lay it out in such a format. If there's any comments, I'd welcome them.
Excellent. Shall I start then? I may as well launch in. Having read it, it is a very good document and it does go into great detail. One area which I did think that it could benefit from is there's a lot of statistical information that gets swallowed up in the what I call the sort of explanations of some of that. And I think it would be quite good to sort of pull out and have like a statistical upfront sheet to highlight, maybe just to highlight some of the sort of pressures and needs greater. It's sort of, there's a lot of stuff in here which is quite, it's going to be very challenging. If you look at like the workforce going forward, the requirements involved, and I think in some sense you could do with what I call a statistical executive summary, maybe. That was one of the things I thought, to sort of just put more emphasis on some of those figures, because it's a big long document to sort of read. The other area which in essence isn't in there, and I sort of understand why, but I also feel that we perhaps ought to sort of really, we need to be pushing this more, is the prevention strategy. Because in some sense, when you read this report, we are on a road to doom and gloom if you're not careful. This whole workforce recruitment, by 2035, I think you put it down as and things. What happens if we don't sort of get all this sort of pulled through and sorted out? And as I sort of read this report, the sort of areas that I sort of, this is me and my view a little bit, and so it's not necessarily the market report, but in some sense, what you've highlighted is a lot of areas of high risk. But we've become so risk averse by policy that if we're not careful, innovation is stifled because we won't take a risk. And so therefore we maintain our current path of heading down this road of, in effect, massive pressures all the time, because unless we try something new and be prepared, not necessarily to fail, but sometimes out of trying something, that's when something new emerges. And in some sense, COVID has, because of the restrictions put on place, forced us to, in effect, open up new ways of working. And I know, and as a sort of, in some sense, I think we should draw more innovation into it, because otherwise, if we don't change, we've got a headache in 2035, if not before, especially when it comes to workforce recruitment, etc. And I don't know how you put that into a market statement position, but in a sense, what you're trying to do with a market statement position is recruit to sort of, in some sense, businesses into Lincolnshire. So, and there's perhaps ideas out there, but of course we're always blocking them by the fact of risk. And it's only just if we want to stimulate for the future, maybe we should really encourage more of it in places like this. I don't know. That's just me thinking.
Thank you, Chairman. If I can answer the workforce specifically, in terms of the information provided there, that is as up to date as it possibly can be in terms of the direction support government's putting in place. And also, I think the way the sections are laid out does at the end of it give some intention of each of those different commission services. So working with partners, community development is quite strong throughout, and also the invitation for innovation. Perhaps that does need to be improved across all sections. But in terms of workforce, I do think hopefully that does come across. But absolutely, what we have tried to do is avoid making it doom and gloom to some extent by focusing on all the pressures. And I think one of the risks of a market position statement and reviewing others in the process of drawing this together, a lot of them do immediately say adult social care is under significant pressure, there's no budget and all the rest of it. And we have tried to move away from that by giving statistics where we're moving to and some of that opportunity as best we can. Although obviously there is the context of a difficult situation. And I do take your comments from that.
Glenn?
Thank you, Chair. So there's quite a lot in your first comments. The first is that once agreed for the original document would then be translated into an easy read version. And that's where we get into an opportunity to create a more graphic presentation to reduce the narrative. So that will simplify and summarise.
Yeah.
And the guys will work on that once we've reached a point of agreement on the main document.
Right.
The second thing to mention, the future is very much dependent upon what the government publishes this year. We know that the government has been frustrated for 12 months. It had a legislative programme and a number of reforms in the public sector, none of which have happened because of COVID. What we're beginning to see now, though, is a range of white papers being published, mental health, health and social care. We know that later this year there's going to be a social care white paper and also one on future funding. So I think the committee, when it comes back after the May elections, will have a fairly busy programme as a result of the government picking up the pace on the legislative programme that it has been delayed with. And then finally, Chair, if I can reassure committee members, we are very fortunate in Lincolnshire in having the opportunity to invest in what we call proof of concept. So we use a little bit of the money available to us to invest in developments and new services that we think will work for a time-limited period. We will then evaluate them, and if they do happen to work, we will then put the money aside to underwrite long-term costs. You've got the One You service to committee today, later on the agenda, that's an example of that has shown really good value. We've had previously the digital roadmap, which has had a number of investments attached to it, the Fall service, the rehabilitation service, and of course you've got Housing for Independence later on the agenda as well. So quite a lot of new initiatives that are showing the council being experimental at a time when most councils frankly just can't afford to.
Yeah. But maybe, Glenn, that should become more, because in some sense, I mean, I'm a bit of a reformist anyway, so I'm sort of, in some sense, we should have maybe that sort of innovation as part of it, so that we sort of, because in effect, if people speak up, it's like a committee meeting, isn't it? People speak up, everybody then chomps about on the words and chews over, and actually what comes out is often the modified version of actually a good idea. So, okay. Well, we've started the ball rolling, so I've got Rob Kendrick and then Mark Whittington next. Rob?
Well, actually, Glenn has answered the question I was going to ask, which was about the presentation in a sort of easy to digest summary form. Looking through it, there are so many useful or interesting facts and figures which we could use when talking to our residents and parish councils to explain the sort of complexities of the situation in a simple form. I think that would be fantastic, and I look forward to seeing that, Mr. Chairman. Thanks very much.
Excellent, thank you. Councillor Mark Whittington.
Thanks, Mr. Chairman. I jotted down lots of things here on my notebook. I demographic time bomb for both people needing care and also care. Sorry, the challenges posed by COVID, ways of working. I think pretty much actually from everything that your discussion, Mr. Chairman, and Graham's answers, I think pretty much everything's been covered. But a couple of smaller things. I'm just wondering if, and I know this is maybe related to the staffing issue. I mean, what can we do to maybe get the message across to a lot of our young people that actually the adult social caring profession really is a very, very, very valuable career choice, and how do we sort of encourage more and more of our young people to think of caring as being a worthwhile and rewarding career, because I think that's the only thing on my list that hasn't previously been covered. Thanks, Mr. Chairman.
Thank you, Mark. Anybody like to comment on that?
I don't know whether Gareth or Claire would wish to, Chair, but I can. I think Councillor Whittington hits on one of the key elements in what we might anticipate will be the government's social care white paper later in the year, which is a national workforce strategy for social care, which will include elements about not only recruitment but retention, particularly as Councillor Whittington indicates for young people. We tend to have a certain age profile within adult social care, particularly in care workers, that shall we say, could be shifted to our advantage. At the moment, of course, one of the key limiting factors is the challenge of competing with the hotel trade or the retail trades. We know that the big supermarkets can typically pay more per hour, and that tends to have an impact on social care recruitment, particularly for younger adults. But one of the things that attracts young people and keeps them in social care is the career structure. And that is one of the things that we're working with Lincolnshire on, to develop senior care worker roles as a result of some of the COVID experience, where care workers have actually taken on some of the, shall we say, lower level health functions in supporting people at home. That kind of overlap between health and social care provides us with opportunities to restructure some of the things that go on in adult social care and to become more attractive for young carers. We know, for example, that nursing associates are now formally a route into nurse qualifications, and more young people are looking at becoming a nursing associate as a route into nursing as a full-time profession. So a number of developments taking place, but we ultimately do need the government to give us more support to be able to genuinely recruit the kind of numbers that we're going to need in the future. Thank you, Chair.
Thank you. So, Liz?
Thank you, Chair. Actually, I've got two things to say now, coming out of what Mark brought up. Without getting too personal, my own daughter, an outside caterer, obviously she's had no work for nearly a year. She's taken a job as a cook in a nursing home. Never thought she'd enjoy it. I cannot tell you how happy she is. She is just loving working with elderly people. Yes, she's cooking. She's making sure they've all got lovely meals. It's really made her just so much happier. She was, previous to being a light caterer, she was teaching physics in grammar schools, hated that. She is so much happier. And I can honestly say, I don't think people know, they don't understand really what it is. She's caring, she's cooking for them, but it's caring in a slightly different way, isn't it? And I can honestly say she's a different person. But the real point I wanted to bring up was on page 1026, we talk about the greater use of the right technology. And I can remember about 18 months ago, we talked about the possibility of, in the future, thinking about maybe 10 years, bringing out technology to use in virtual care, in care. And now, look at us, we're sitting here online and they're using technology so much more in care. And it's happened really because of COVID. And we've moved on at a massive pace, haven't we? And I just think that's actually proved it was, I mean, I didn't like the idea of it then. Now I think it's fabulous. I can see the benefits of it. But that was all. Thanks very much.
Thank you. So, Councillor Christine Lawton.
Thank you very much, Chairman. Some of my comments have been addressed by other members, so thank them for that. Just one simple question to answer. If this is a statutory requirement, why have some authorities not submitted this paper as we have? That was just a first query. The other things are, I look on page 25 about turnover rates, and the rates are lower for turnover for providers who recruit for values. I'm assuming recruit for values is about development, about moving on to doing, as Glenn spoke earlier, about improving their roles. But recruit for value seems to me really important. And that's what Liz was talking about. Values are probably more something that you hadn't realised was part and parcel of the job. And you realise the importance of it once you're in there doing it. And I think in Lincolnshire, we are fortunate. I mean, Lincoln, that I have missed so much the Carers Awards, where you actually speak to the people working on the ground. I really missed that. I'd like to pay tribute to all the work they do and all the workers they support. But we're also the ageing population to lead to an increased demand for social care. And we're approaching this from both ends. We're now supporting independent living in a big way so that people can stay in their homes. But we've got a better residential care than great many, so that we can support those who do have to have residential care. But I'd like to pay tribute to all of them, and would like to see young people going into this for careers. But I wonder if Brexit and its stopping Europeans maybe coming here to work, has that impacted on our workforce at all? I wonder if that's made a difference, so that we're finding a problem recruiting from the young people who used to come here from Eastern Europe to work in care homes and hospitality as well. Just a couple of things, but really, really impressed with all this work. Thanks very much.
Thank you. Anybody got any comments? I suppose the trouble is everything's a bit tricky to answer whether the impact of Brexit has actually had an impact, because what with COVID and all the other issues, everything's got a little bit distorted, perhaps a better word.
Yes, exactly.
And I think you're right, it will settle down. So just, and Glenn's going to come back in, and just add a bit more into that, Glenn, while you come back in. So is there a white paper coming out then on the workforce, sort of, i.e. with the whole workforce of adult social care? I mean, the one area that I look at is and I've always had this, and it's why I sort of always got involved with adult social care, they look after everyone in their dying needs or in their hour of needs, and they have no respect in some sense, and yet you'd put on your suit to go and see the bank man, who would then rip you off for money and charge you a fortune. And it's like that sort of balance of life was sort of out of drift 10 years ago, and it is coming round. I mean, the thing about NHS nurses is they do work in very nice surroundings and are more what I call uniform surrounding. Pretty much a hospital setting's actually quite, you can say what you like, but generally they're sort of a bit of a buzz about them. There's quite a few people there, so there's social interactions. And the same with large nursing homes, but you get in a smaller one and you're perhaps more isolated and on your own. But in some sense, whatever they do, they should. And it always comes down to wage, isn't it? You know, and this is where we try and go with the living wage versus the basic wage. And in effect, if they are in care and providing care, when they have done a life service, they should be pensioned up. They should have a quality of life. And I think sometimes they're the elements that actually are put in place. And like you say, this whole career path isn't really obvious. And in effect, they are the obstacles that stop people going in. Glenn, I'll let you come back on that because...
thank you, Chair. Members will have noticed I've been scribbling down. I've got about 6 points, but I'm going to try and be very succinct in covering them all. So can I thank Councillor Lawton for her comments. It would be useful, Chair, if these could be recorded in the minutes, and I'll make sure that these are passed through to colleagues in social care, which I think always is valuable. It's always nice to be recognised and to be valued. Having said that, the values-based point is well made. What we know is that salary and career are two good reasons for entering a role, but they don't necessarily keep you there. It's typically your values, what's important to you, how you get reward at a personal level beyond your salary is what keeps you there. And we know typically that whilst recruitment isn't bad, retention is the real challenge. And we find that between 30 and 35% drop off after 6 months, because the challenges of doing social care well are considerable. It's not an easy task. It requires skills that, frankly, many other industries would not demand. Having said that, it's interesting that Councillor Lawton asked us specific about why aren't other councils producing a market position statement. Frankly, it's because the government isn't looking. And given the pressures of running social care, particularly in the last year, some councils, frankly, haven't had the resources. We've been fortunate in Lincolnshire to have colleagues like Gareth and Claire who've been able to put the time to it to produce a document for you today. The other thing to bear in mind is that Lincolnshire hasn't yet seen much of an impact from Brexit and changing patterns of migration. I think that's partly as a result of shall we say, a very artificial year, which was the COVID year. We probably will need another year at least before we're able to fully understand whether there's any material impact on movement of staff, people coming in from other countries, and whether that's material in terms of overall recruitment patterns. And finally, just by way of reassurance, in 2018, I visited the Lincoln Care College, which is a dedicated facility next door to the Lincoln College, which deliberately targets young people, 18 to 25s, into a care career that we are supporting along with Lincoln. And it's one of the few in the country. I met some of the young people training as care workers, and I have to say was both reassured and really quite encouraged to hear the kind of stories they were telling to why they were entering the profession. And yes, they want careers, but their starting point was so good, it has to give you some encouragement for the future in Lincolnshire. Thank you, Chair.
Thank you very much. I've got Councillor Marrick, Overton, and then Councillor Rob Folkes.
Thank you. Hello there. Hi. Thanks a lot for that. I've got quite a few questions. I'll just run them together if that's okay. Firstly, a very warm welcome to the document. It's very good to have, I must say, and I'm sure useful. What it doesn't necessarily do, I think, is it doesn't put figures on how much money is going to be available, of course, because I guess we don't know that. So it just puts what's there. But does put that we're expecting to put contracts in. On page 30, it does put the expectation of a contract in 2020. So I just wonder if that's happened or if it's or if the document just was tweaking. On the demographics, page 23. I think I understand this. Do I understand it correctly? It looks like I know it's a small graph, but it looks as if the over 65s are not increasing. It might be that I haven't understood that properly over the projected years. On the graph on page 23, I think Series 1, Series 2 is meant to be years to match the neighbouring graph, I imagine, in which case it doesn't clearly show to me an increase. Maybe it's because the graph's too small and I can't see it properly, but I thought that we do have an ageing population. So just checking if that's still the case. As I say, maybe just I can't see it properly. Then the second part is on the page 37 is about the self-funding, and you've got self-funding in residential homes as going down, yet the council funded people in homes you're expecting to stay the same. I'm not sure why or how that would work, because it might mean if it's too expensive for private people, is it not also too expensive for the council ones? I'm not sure how that works. But anyway, it does mean that the clear intention is to help people stay at home more, which I think is, is what we all agree at. On page 45, people with disabilities clearly increasing. Really pleased to have heard at first hand recently. I met somebody who has taken into her home a Downs person, an adult person with Downs, and she said it's been working well for a couple of years, and it's a county council initiative, so that those people are not locked up somewhere. They're very much with the family. So even though he's under adult and he can only go out with the person that's caring for him, it's really working well, and I'm just really impressed. What a nice thing that is for the person being cared for, and indeed for the carer to do. I think that's a really good initiative, and congratulations to the council on doing that. And I think that's it for me. Thank you very much.
Thank you. Who wants to take and answer some of those questions? Gareth or Glenn?
Sorry, there was a fair amount in it there. Sorry, Glenn.
Thank you, Joe. Shall I start, Gareth, and then you, if I leave you, in terms of future funds, we do know that the government intends to reform the funding of social. We'll start to hear more about that later this year. At the moment, we have published our own medium-term financial plan for the next 3 years as part of the corporate financial strategy. And I can reassure members that we're on a fairly solid wicket as well financially for at least the next year, or possibly any pressures arising and any future funding agreements. In terms of future contracts, again, I think the committee after May will find itself very busy, as we have some very significant contracts coming forward, particularly for residential and home care. And these are the two single biggest contracts we have. They will be multiple year contracts, so of some significance to us as a council. In terms of the demographics and the graphs, Gary, funders, and that going down, whilst public sector funded people are likely the same. We think, Councillor Overton, that is pure to a fear factor, that people have been not choosing to enter into residential settings as a result of the fear of catching COVID. That's a national phenomenon as well. And what we're seeing in Lincolnshire is reflected nationally. What we're trying to do, of course, is then encourage those people to stay home with support and to support those with either preventative services or give them better information and advice. In terms of the Downs person who was looked after in a family home, my colleague Justin has got a programme of increasing those opportunities for working age adults to live with the family. It's called Shared Live, and we have a future plan for more of those services to prevent people needing long-term residential or inpatient hospital facilities. And I'll leave the rest to Gareth, if I may, Chair.
Thank you.
Thank you, Glenn. Thank you, Chair. As Glenn made the point I was going to make about self-funding, which is great. What I will take away, however, is to ensure that there is clarity on the demographics and the tables that are presented, just so that there isn't any potential confusion. Thank you.
Thanks very much.
Thank you. So, Rob?
Thanks, Hugo. Sorry, I'm having a problem with clicking these icons. Glenn may have answered this already, actually, but maybe not. On page 26 of our agenda pack, it goes on about the government wanting to encourage digital, the use of digital technology, etc., in the future. But if the government want to do this, can we make sure that the rural nature of Lincolnshire is understood with respect to mobile signals and broadband? And we're not just the same as, say, a London borough in this respect. In a way, it sort of echoes our fairer funding campaign. But, Lincolnshire is such a huge place, and I can imagine a government basing their sort of assessments on Wandsworth or something like that and expecting it to apply to Lincolnshire. Thanks.
Thank you. I think Glenn's coming to reply.
Thank you, Chair. Councillor Fuchs actually makes a really important point around not just the expansion of digital technology across both health and social over the last year. We've had a step, but I think there's more to follow. I do know that the government intends to do a lot more for both NHS and social care services in future legislation. But I was only talking about this subject and the fair funding review with Councillor Bradwell yesterday. And I noticed, Chair, that Councillor Bradwell, I think, is joyous. It's a new drum on the relevance of rural prayers used for social care, but for the councillors as a whole, because it does cost a lot more. Such a vast and Chair, I don't know whether my portfolio holder wants to say any more about that.
I will just come in, and any members of the public listening, it's not Glenn that's speaking like he is, it's sometimes the actual internet service which causes the sort of tone of voice to change.
Excuse me, Chairman. Could we say when we've got a bad connection that like Glenn turns his camera off to see if it's any better, Chairman?
Yeah, that's fair dues. So, okay. Well, I think all in all, a very good document. One last thing, which is on page 34, the quality between 2017 and 19. You've undertaken 2 comprehensive experience survey. Does that survey only relate to those people connected with LCC, or does it also bring into account all the self-funders and everyone else that we do not necessarily have contact with? Gareth, I think that's one for you. Do we actually reach right out to the care world, or is it really just those connected to LCC?
I was hoping, Claire, are you able to support in?
I'm just thinking, we could find out from the quality team. As far as I'm aware, it is only LCC, but we can make that clear in the document if that's not clear enough.
Glenn, I think, wants to come in, but thank you for that, Claire.
Thank you, Councillor Marfley. I'm just going on to audio so as to try to preserve my network connection. Claire's right. We typically evaluate quality against the people who we are funding, although it has to be said that if we are reporting on residential services or home care services, the CQC standards would apply irrespective of whether you're a self-funder or you're state-funded.
Yeah, that's a fair comment. So, okay, and just finally, I did see that Councillor Patricia Bradwell has arrived in the meeting, and just would you like to have any comment on this, Councillor Bradwell? If she's still here. Right, we'll carry on because it's sometimes difficult to know. Right, well, I think that's been very useful. I think certainly from going forward next year, and I suspect the next session will have huge amounts of reform and a lot of interesting white papers come forward, and perhaps at long last, one of the legacies of COVID will be actually how are we going to fund, how are we going to do everything, because it's highlighted the really good work that our frontline staff and everybody does and the services required. And so it's certainly going to be an interesting period going forward. I think we've had a very good debate. There's some good comments being logged, and I think we'll see those in the minutes. And obviously, Claire and Gareth, you've heard the comments. Is there anything actually you two would like to just say before we sort of wrap this agenda item up?
Thank you, Chair. Probably the final point to make is this would be hosted online. So in terms of updating sections and doing that more regularly, that's a position we want to move to. So it is a bit more of a live document and can evolve in response to some of the changing dynamics, as you've made the point. Thank you.
Brilliant. Thank you. And just actually that final point, we do always have to be mindful, and the market position actually is actually good online because that's actually where it is. But in a lot of sort of adult social care world, as I've just had to sort of been supporting somebody actually who isn't online, it actually becomes really quite difficult to find out what's what when somebody isn't online. And when everything is done, like universal credits and everything is now all online, when someone doesn't have internet and actually has no idea what they're necessarily doing on it, by Jove, it doesn't half test you when you have to find out when you haven't got those facilities. So we must always remember that at present, while there's still quite a few people out there that aren't on that. But I don't think actually that's not relevant for actually this report anyway, because it's more geared up for businesses actually looking at our position. So, but yeah, great piece of work. And I think all I'd say is I think that really when you get down to the summary of the writing it all up, then actually I think it wants to be one of the first things that goes to the next committee, because I think it really summarises so much up of where we are and the direction. So thank you both for your work, and well, I'll say we all see you next time. We don't know who's going to see you next time, so you'll see whoever you'll see. All right, thank you.
Thank you.
So, okay, we'll move on to the next agenda item then, performance Q3. So we have Caroline Jackson, Head of Corporate Performance, to start the agenda item. So welcome, Caroline.
Thank you, Chairman. Page 65 of your pack, hopefully you'll see, has the performance report, which outlines the performance compared to target for service level indicators for Q3 2021. There is a full appendix from pages 69 to 100, which has all of the kind of further level detail for every single kind of measure, including kind of graphical representation and benchmarking data and commentary. So in Q3, of the 16 measures that we were able to report on, 12 were either exceeding or achieving their target, and 4 were not achieving their target. So I'm going to start and concentrate on those that were exceeding their target first. The percentage of people aged 40 to 74 offered and received an NHS health check. You may recall that this was exceeding its target previously in Q2. I would say there is a data lag for this measure, so which is likely to mean that in future reporting we will see the reduction in this measure due to those people being able to offer and receive as a result of the impact of COVID-19. So as I say, it is measured on a 5-year rolling basis, so obviously covers a large period. So impacts of and a data lag, so impact of data does take a time to kind of come through the system. So for Lincolnshire, during Q1 2016-17 to Q2 2021, which is the period of this measure, 63 the overall percentage of people taking up an NHS health check was 63% compared to an England position of 46.7%. As I say, it does take a while for any kind of impact of COVID to impact on this measure. And we do know that during 2021, the NHS health check programme has had a reduction in activity across the county, and each GP practice is able to self-determine when to restart their NHS health checks, but all practices are expected to restart from April 2021. So as I say, we are exceeding with that one at the moment, but it will be a while before we see the kind of impact potentially of COVID. Permanent admissions to residential and nursing care homes for clients aged 65 plus. Again, this also exceeded its target in the previous quarter, in Q2, and also is likely to have an impact of COVID in future reporting. So admissions for those aged 65 plus into residential and nursing care has continued to reduce. It's in part due to kind of continued work of the teams to help people stay in their own homes for longer if that's the best option. However, another cause, as we've already kind of alluded to in previous conversations this morning, is around the current pandemic, which at the start of the year, obviously we discussed this last time, we've seen fewer contacts being received into LCC, and so the number of people receiving a long-term service has reduced. Those percentage of alcohol users that have left specialist treatment successfully, these are those that are now, that have not achieved. We'll move on to those. So the percentage of alcohol users that have left specialist treatment successfully has reduced from 33.6% in Q1 to 30.8% in Q2, which is the period we're reporting on for this measure. And that was against a target of 35%. And again, although we saw improvements in Q1, the impact of COVID-19 is now being seen within the substance misuse service performance. I think we discussed this last time around the challenges for substance misuse treatment services. Lots of revised guidance, released by the Department of Health and Social Care. Most people are currently being seen remotely, with face-to-face appointments being reserved for those deemed at highest risk. Services have maintained regular contact with people throughout the lockdown. However, the focus has been on keeping service users and staff safe. I think, again, touched on this previously, that evidence suggests that alcohol consumption has increased through the pandemic, and it's anticipated that we will see people seek help, or anticipate to see higher numbers of people seeking help as restrictions are relaxed. And this could obviously affect future performance, and we will monitor that carefully. People supported to successfully quit smoking. I see there's a service review paper as item 8 on this agenda around the 1U Lincolnshire service. So for this quarter, 1U Lincolnshire achieved 63% of its target. Again, as a result of the COVID-19 pandemic, as discussed last time, a lot of services have moved to telephone and digital support for smoking cessation, with nicotine replacement therapy being delivered by post in order to maintain the programme. The transition to this new delivery model was obviously in response to the lockdowns, and it has meant that they've managed to maintain the stop smoking service. And they've subcontracted services with pharmacies, and primary care setting has mainly been suspended, although a few did restart delivery between lockdowns, which accounts for 9% of activities. But there is, as I say, a service review paper later on the agenda. In terms of adults aged 18 to 64 living independently, for Q3, the performance was 65% compared to a target of 75%. So the Lincolnshire Partnership Foundation's trust continues to ensure that those individuals who are supported by social care under the Section 75 agreement, and in addition to the care programme approach, are in accommodation settings to ensure their safety and well-being. And whilst the target hasn't been achieved, we are still in line with comparator authorities. And again, it's a low number of people, so it does have quite a bit of volatility in terms of this measure. And finally, in terms of adult safeguarding concerns that lead to a safeguarding inquiry, Q3 performance was 41.9% compared to a target of 48.25%. Again, the local Safeguarding Adults Board continues to work with partners to embed learning going forward, but some of that activity has been delayed due to COVID-19. I'll now hand over for any questions.
Excellent, thank you very much. So, yes, when you're going through it, I mean, the impact of COVID, and it certainly distorts, and I think there'll be some elements that perhaps, like admissions to residential and nursing. Well, in some of that, how much has people being told to stay at home has reduced falls and impacts that otherwise would have led to potentially admissions into there. And some might be perhaps not so permanent, but that might be a case that actually, but as we know, sometimes when people fall, it then leads to a permanent placing because of the whole age and time it takes to recover. But I suppose in some sense, if you don't watch it, you spend ages analysing, and at the end of the day, I think we have to I think we have to carry on reporting and accept that there are elements that we are going to achieve and fail in both counts just because of current situations. But at least it highlights that we are still taking an interest and still trying to resolve. And I think some areas are, like we say, we have a reason, and others might be more disguised. But all in all, I think it's a lot of it is good news. So okay, I've got Councillor Christine Lawton who would like to speak.
Thank you very much, Chairman. It's just a light-hearted remark, really, on the percentage of people aged 40 to 74 offered and receiving NHS health check. What have you got against us over 74s? Have you written us off? But that was just a a light-hearted remark. But I'm also on the percentage of alcohol users. I am heartened by the recent statistics that younger people are actually drinking less alcohol. It's not the it's always the minority who get the attention, but the facts are that younger people are increasingly not drinking alcohol. So that's something for the future that may stand us in good stead unless they turn to drink in their old age. Just so, thank you very much, Chairman.
Thank you. It's quite an interesting one, the alcohol, actually, because when you look at, I mean, I'm in the food and beverage industry, and when you sort of look at some of the statistics, actually, overall, there's not been the massive consumption increase like we all expect. So I think it's sort of like you say, you end up back with an average, and actually I think some of the younger lot aren't, and it's perhaps sometimes maybe it's my age group over 50s that might hit it harder. I don't know, but I think, and that's actually perhaps some of the cases that I think it's certain age groups that actually are perhaps more at risk than others. But yeah, those are sort of areas. It's how you know, if you don't watch it, trying to look at it statistically, if you don't, you could actually spend days trying to analyse certain information, I suppose, and that's sort of it. But I think with things like that, it would be worth just knowing at times if it is a certain age groups that really are more high risk, because then we can be a bit more focused in the way we sort of try to champion our approach to sort of combat it. But yeah, well, I've got Councillor Marianne Overton to speak as well.
Thank you. I think that's better. Also would like to pick up the alcohol one, because what we don't know is if younger people are turning to drugs instead. And I was looking through the pages and I can't see where it says anything about whether more people are taking drugs instead. I can't see normally we have a measure for that, but it doesn't, I can't see it on there. So I am concerned about that. And I think also, obviously, always it's the tip of the iceberg, you know, the people that actually come for help, and the problems are much more deep-seated. I am interested in Hugo's suggestion that people are not drinking more. I don't know what the measures are that one would make, whether it's one natural, you know, obviously Councillor Marfield's got an amount of experience and knowledge about the issue, I should say. But I would be interested if there were some facts, because my local shop tells me people are drinking a lot more. So I'd be interested in that. I think it is something we should be careful about, because is this a subterranean volcano, you know, we need to be careful of and be ready for, and is there a turning to drugs that also needs tackling? Okay.
Thank you. So would you like to just come back on anything, Caroline, or?
I was just checking about the substance misuse. At the moment, I will go back and check and come back to Katrina, but I thought it was just the alcohol and the smoking, but I will check on the substance side.
But,
thank you.
I've got Samantha Neal would like to come in. Welcome, Samantha.
Thank you. Just briefly, the other side of the coin with this is the Joint Strategic Needs Assessment, the JSNA. A lot of the JSNA work has been on hold, but again, as we go into recovery, we will start to pick that up again. So the queries and questions about changes of behaviour, different age groups, etc., will start to be factored into that across all of those different topics. So if you can bear with us until we get that programme rolling again, I think that will start to answer some of the questions that you're asking into the next term of the administration in terms of age groups and maybe changes in that. There may be big changes, there may not, but that's the sort of opposite side of the table in terms then of the performance, isn't it, in terms of what's going up, what's going down and what's changing.
Excellent. Well, I think more will come out as we progress anyway, and obviously recover, and you know, and actually when you look back, that'll be quite interesting, because that's the other thing. Actually, it'll be interesting some of the knock-on effects which will benefit or cause more problems. So, but Well, thank you for this, Caroline, and we'll leave you with it all. Thank you. So, okay, we'll go on to item number 7 then. Mental Wellbeing and Suicide Prevention Action Plan. So, Sabrina, I welcome you. Is it Sabrina?
No, it's Shabana.
Shabana, sorry.
That's right, you can call me Shab.
Welcome.
Thank you.
So, okay, would you like to just do an introduction? And
yeah, absolutely. Yeah, thank you for having me here today. I'm acting up as a programme manager within the Public Health Division of Adult Care and Community Wellbeing. And today I've come today to present around the work that Public Health Division have been doing around mental health and suicide prevention. So as you know, there's a lot of work going on around mental well-being, mental health across the whole of the system. We've got the transformation programme within the CCGs. We've got the work that with Justin Hackney's team's doing around the managed care network and the contract with LPFT and delivering the social care elements of that. So today's just really talking about the work that Public Health have been doing around that. So my understanding is that you've been able to go through the report. So I'll just highlight some of the key points that I'd like to raise and then open it up to Q&A, if that's okay.
Yes.
Lovely. So I've split this report into 2 sections, all around one section around mental health and one section around suicide prevention. So just an update around mental well-being. As you know, that the local authority have got a really good programme to support our employees. It's one of the most fundamental things that we should be doing as a local authority. And as part of changes with COVID, a number of different things have been changed within the service that was being offered. And that's been led by my colleague in Public Health. And for me, the key things was around updating the web pages so people were more aware about what's available for them around coping, financial issues, relationships, that sort of thing. And what I found really interesting was the team had developed lunchtime wellbeing sessions. And I think that's absolutely fantastic because there's motivational Mondays, workout Wednesdays and wind down Fridays. I just think that is just absolutely fantastic. And I know a lot of people have been taking that up. We've expanded our 1U offer. So 1U Lincolnshire has always been around since conception, and it's been there for our staff, rightly so. And I know that the service continues to be supported. We've done a lot more around resilience and some resilience modules that's via Links to Learn. And at the time of writing this report, it was at 45% people are booked on. So, I mean, I'm sure we've been promoting it more and I'm sure more people have joined. There's also a mental health first aid programme of work, and that has been, I don't know if you know the details, but we've received some funding from Health Education England, and it's a programme of work that's being led by the CCGs with LPFT, and to ensure that our system, so our leaders, some of the system have got key people that are trained on mental health first aid. Is going to be something that nationally they look at as having a standard. So like at the minute we have emergency first aiders. So it's the same principle that we will want to have mental health first aiders. So it's a programme of work, and you know my colleague Dave has been working really hard to ensure that we get a number of people trained in LCC, which is absolutely brilliant. And then we've got our counselling service, and that's just been adapted to ensure that we do online support, telephone support. So I think that's absolutely fantastic. Another bit of work that the team have been working on is around the loneliness and social isolation work programme and the agenda around that. And we know, COVID has really, really shown, I think everyone's been made aware now about their own mental health, and that being told to shield and your sort of liberties taken away has a really massive impact on your loneliness, social isolation, and it has a massive impact. So we've got a programme of work looking at the Joint Strategic Asset Assessment, which is looking at all the pieces, what's out there in the community. It's looking at all the facilities, what rooms are available, what services there are, and it's about making sure that the public, but also organisations, are aware that they can offer their service for this price or for free, and that if someone was looking for a place to rent or to do a service, they could go to this organisation. So that's what that section's all about. And we've got rural and coastal communities. So a paper went to you guys, and we really need to be looking at our rural areas and some of the deprivation, and obviously with COVID, it's had an impact on people working. So there's a lot more work that needs to be done around that, and how the rurality and the loneliness and isolation, particularly of those that are shielding. You know, all about social prescribing, and that is a massive piece of work that's being done across the whole system. Social prescribers is going to be one of the key things that is going to help with loneliness and social isolation. So that just continues to work. We continue to work with the CCGs and all the neighbourhood teams and the primary care networks. Communities of Future project, it's about expanding or providing support, for range of support for people who are lonely and isolated, and it's to make sure that our hubs are equipped with the right support, and that we've got a digital offer. So that's being led by another member of the team. So that's going to be really good working with employers. One of the other things I'm really pleased to announce is that during COVID, we've been able to do a social media campaign around the 12 steps to better mental wellbeing. So, and we're now in the process of developing that into a leaflet that can then go out to everyone in the whole system, everyone. It's just giving some key tips, and it's just a really vibrant, encouraging document about just looking at your life and saying these are some of the steps that you could do to make your mental health a little bit better. So, sorry if...
Is that document ready?
Pardon? Yeah, I'm just in the final process of, I'm just getting, it's been designed, it's, and it's just going through our communications team to make sure that we fit the LCC standards in terms of font size, the right, all that sort of stuff. So that should be ready, I'm hoping, in the next couple of weeks. So that leaflet will be ready and be able to be sent out. Just really quickly around the mental health webinar that we had in October, absolutely brilliant. First session we ever had. Councillor Bradwell supported this and spoke at the event, and it was just a really good opportunity to start a conversation around mental health and mental well-being. And it was really good to be able to showcase some of the work that we've been doing. So what our mental health universal offer is, what the transformation programme is, what we're doing around suicide prevention. So that was a really good event, and hopefully it was something we'd like to continue doing again and again. And just some of the impact which we've talked about before around COVID is those shielding, lonely, isolated, anxiety, depression, and just some of the key work that we want to carry on doing is the employee work with communications department, making sure we've got the key messages, delivering the action plan, working on the joint health and wellbeing strategy and the JSNA topic. So I'll just quickly go on to the suicide prevention work, if that's okay. And I'm just delighted to be able to say to you that in October, we were able to publish our first Lincolnshire Suicide Prevention Strategy and Action Plan. And it's been really well received, really positive. The action plan's going really well. There has been some delays with some of the actions, but I'm really delighted to be able to say that we're engaging more with people that have had self-harm and suicidal ideation and attempts, but also those bereaved. We have a temporary bereavement support service in place, a very low-level one. So if anyone that's taken their own life and the next of kin is obviously needed some support, there is this telephone helpline to help them. It's very low level, and we'll look to get something larger as we progress. We've also been successful in receiving some funding from NHS England and Improvement around setting up some groups around supporting males and suicide, because they're one of our higher risk. So that's going really well. At the moment, I'm evaluating 27 application forms, and we're looking to award a number of contracts with people and grant agreements. So it's all going well. The delays have been around developing the pathway, and that's the next thing on my list. So as soon as I've done the grant agreements with the organisations around male suicide, I'll be able to work on the pathway work. And the real-time surveillance work is I'm currently looking at outsourcing that to an organisation called Health Watch Lincolnshire, which you know about. So they will be looking at the analysis work, gathering the data. So that will give us a bit more intelligence around that. And again, with the data sources, we have started to look at other types of data sources. So yeah, there were the sort of things that I wanted to sort of just raise. But it's for me, the COVID pandemic has had an influence in the work that I've been doing. So I'm really pleased about that. I'm open to any questions.
Okay, well, I've got Samantha that just wants to come in, and then I'll open it up to the floor. Thank you for that.
Yes, thank you, Chairman. A couple of things just to note. First of all, just a brief note, Derek Ward is joining the meeting shortly, but his previous meeting is overrunning. I know that he was really keen to be part of this item, and I think this is testament to Shab and to a lot of people who have achieved so much over this last year. If you scan down the action plan and see how much of that is green, that's a massive achievement in terms of what we have been able to achieve over the last year. And I think I would just re-echo the point that Shab has made. The items that are currently slightly behind schedule have been directly due to COVID impact. And I think what I don't want you to go away feeling is that we're complacent. The fact that those areas are green, as I made the point earlier, we're watching the situation very closely in terms of COVID, not just the short-term impacts, but the longer-term impacts. And the subsequent issues that come out of that in terms of pressures on employment, on finances, etc., which underpin a lot of the conditions that people then go on to develop. So as I said earlier, the JSNA, the needs assessment, is going to be critical to making sure that we keep this moving forward. But I think for you as a committee, hopefully this gives some assurance that Lincolnshire is on the case and that we're making good progress in spite of the challenges.
Excellent, thank you. Right, I'll just start off, because one of the things when you've just been speaking on the Lincolnshire County Council's Employee Health and Wellbeing Strategy, and it sort of, I suppose, springs to mind that you've done a lot of work here, as you said, Shabs, about everything, and that, you know, and the work that has gone into it. In some sense, I suspect we've developed a whole situation and solutions that we sit on as LCC. Actually, there is an element here which I think could be rolled out into Lincolnshire businesses where they can adapt this. And I think we need to perhaps look at this and put it on the Lincolnshire Business Portal, or at least speak to them. because the one thing, and we've had a lot of debate about supporting businesses in Lincolnshire, especially at the last council meeting, is a lot of our businesses are smaller and they haven't got the time or the resources to, in effect, drill down and focus. And actually, as LCC's done this isn't a case that we should sit on this work and, in effect, hold it. We should share this with all our businesses and help them, because there's no need for them to go and rewrite the book when we've written it. And I think that so much valuable stuff has come out of this. And actually, a lot of these businesses can help their own employees without actually spending a fortune. And a lot of them don't have the resources either to have something like yourself design this. So I think if anything was to come out of this, that would be definitely one thing which I would personally recommend. Samantha, I know you've got your hand up to come back in on this.
Yeah, I think we're increasingly aware that what we do as an employer is making sure that we do the right things for our staff, but then sharing that, the do it once, use it many times principle. And you'll have seen in a previous report that you've just received some of the information around carers, for example. Everything that we are doing around mental health, around staff wellbeing, around supporting carers, we are sharing as far as we can across the public sector and the wider private sector as well. And that's a key issue. Many of our businesses are one person or small micro businesses, so those pressures are particularly intense in their own organisations, and that will be a key focus as we go forward in recovery as well from COVID.
You're on mute, Chairman.
Thank you for that. Yes, I think it's a good thing. Maybe the leaflet should also go with there, because there are loads of people now that have worked for small businesses. They're on their own, and actually no one cares. And in effect, the one thing we know is if they do run into a crisis mode, it then comes back to us. So I think that would be brilliant to roll that out. The other bit is about isolation. Is always an interesting topic, and as I sort of have got a little bit involved in it over COVID, sometimes, you realise that actually you sort of think that guy's in isolation, and then when you get to know them more, you think actually you don't help yourself. You're a bit of an awkward person, and I'm not saying that because a lot of people are left in isolation, but you know what? There is always a thing. If you're nice to people, people are nice back, isn't there? And I think, and the other area, in rural communities, we have so many events that people can join to, and it's just in some sense, if you don't join those events and you complain about it, and sometimes actually that's what it's about, isn't it? Sometimes you have to motivate yourself, and there are those that actually can't do that because they're in a situation, then that's a different animal, or a different situation really, and therefore support. But I also know that one person that I was helping with prescriptions and his shielding, they got one of the free iPads, and they were absolutely stunned and over the world, and to them that opened up connectivity. So yeah, brilliant. Right, I've got Councillor Liz Sneed first to speak, and then Rob Kendrick. Liz.
Thank you, Chair. Yeah, I really welcome this, because I think at the moment we perhaps don't realise quite the long-term impact of what COVID is going to have had on our mental well-being. And I'm so pleased that there's so much work going on in preparation. I'm particularly concerned about children, actually, because they've gone through something that children have never had to go through before, haven't they? And my own mother says the war wasn't as bad as this has been. She said it was different. And I'm very concerned about the long-term impact on our children. I've a family member whose husband sadly did commit suicide. She struggled dreadfully with her feelings of guilt. And if only I'd known that there was help, because she blamed herself. She said, why didn't I know? And if I had known there was a phone call, she could have rung someone for help. I'm really glad these things are being made so much more easily available now. So that's great. And finally, I and I think Councillor Lawton have been invited to attend a Samaritan suicide management course. And I'm really pleased that we are getting more options. People who don't think they need it, we need training so we can see what's going on in people's lives and help them if we need to. And I'm so pleased this is just becoming more known about, and I think this work that's being done is marvellous. Thanks very much.
Thank you. Welcome, Derek, by the way. Nice to see you here. So, well, thank you for that, Liz. Then I've got Rob Kendrick.
Thank you, Chairman. Yes, on the theme of support for people in the community and the COVID situation, it's obviously become very evident. There are a lot of organisations that have sprung up in local communities to support people, and the Lincolnshire Resilience Forum has obviously got the details of these various groups in the community. I was just wondering if there's any linkage between that and what's being done here, in so much as it would be a shame to lose some of these groups when COVID happily ends, and there might be some people in these groups who would still wish to carry on providing support in the community for people. I mean, the slogan "It's good to talk" I think is as relevant today as it was years ago. And I'm just wondering whether there's any work going on in that respect, because I was involved with one of these groups just as a phone contact for an elderly lady during the crisis, and it just strikes me that we might lose a potential resource there if we don't try and capture that. And the other thing is, at one time I remember LPFT used to run suicide prevention courses for anyone who was interested in that. I'm trying to remember the title. It originated in Canada, the scheme, I seem to recall. I remember going on it. And it just strikes me that I don't know whether they do that now, but it was a very good course for making people aware of how they might help people who are indicating the possibility of suicide. In fact, showing how you can detect whether somebody's indicating suicide, which is very, very useful. So just a couple of points there, Chairman, really. The sort of in cultivating or retaining some goodwill in the community in some sort of coordinated manner, and also suicide prevention courses being made available to people. Thank you, Chairman.
Thank you. Yeah, I mean, suicide's an interesting one, because actually the person actually carries out the action has gone. It's the mess that's left to every other person in the family that causes the absolute emotion and disasters that go on. I've got Derek. Do you want to come in now, or do you want to come in a bit? And I've got Shabs that wants to come back, and Samantha that wants to come back. So Derek, you start off then, if you like, and then we'll go Shabs and Sam.
I'll let Shab and Sam come in, because they'll be able to answer Councillor Kendrick's point with a level of detail that I certainly can't. And then if I may, towards the end, I'll just I'll come back, and apologies for joining late. I was on the Outbreak Engagement Board with the leader. Right, brilliant. Thank you. Shabs then, and then Samantha.
Yes, thank you, Chairman. Yeah, really good points, Councillor Kendrick. Absolutely brilliant. If it's okay, I'll answer the bit around the suicide prevention training. So yes, we did do the suicide prevention training many years ago. We trained quite a lot of people on a course called Safe Talk and Assist. Yep. So and we did an evaluation, and it felt that it wasn't the best route. So as part of this work, on our action plan, there is a section around training. So what I'm doing at the moment is I am looking through what other trainings are available that's out there, and pulling it all together and and once that's been pulled together, we'll start to let people know about that. But what we've done as a system, we're looking at doing the mental health first aid across the whole system, and elements of that has got suicide prevention in there and signs and awareness around that. So there's lots of different types of courses, and I think it's for us to pull it together and then share it with everyone, and then for people to choose which one is best for them. I've done both courses, Safe Talk and Assist. It's a methodology. It's a methodology about when you see someone that's in distress, what do you do? What do you say? And it's really about being human and having a conversation. So that's what I just wanted to reassure everyone that is work that we are working on. Thank you.
That's great. Thank you very much. Brilliant.
And for your information on that one, we did actually, and I mean, I'm flipping back now, must be maybe 8 years ago, Shabs, we did have a counsellor development training session on suicide, I suppose, well, a prevention, but also identifying somebody. And I know David Hare was involved in that, and I can't remember how we did it now, but I know I was sort of involved with council development then, and I know we did have a topic, and we did put it to all councillors, but so that there was some work that we did do or got somebody in. So
that's really good, Chairman. There was Public Health England set up something about 4 years ago as well, and that was offered out to our councillors, but unfortunately it didn't get rolled out as wide as we'd like to have done. So that's something that I can go back to Public Health England with, and see if there's something we can do.
So, Samantha.
Thank you, Chairman. I just wanted to respond to the point around volunteers and community groups. So part of the work that I'm doing at the moment is within the community volunteering cell in the LRF. And there's a number of strands of work there that we don't want to lose. So one of those strands is about the Nhs volunteers who have come forward. Unfortunately, we're not allowed to know who they are, but we are about to put a call out in the next couple of weeks to ask those people to identify themselves to us, so that again we can retain where people want to continue those services going forward. We had a lot of individual volunteers come forward, and what we've been doing is trying to match them with groups in their areas, so that again we don't lose that willingness, but those people are within a safe and secure environment and get training and opportunities around that. And where those new groups have come forward, we've had some DEFRA funding to be able to put out to those groups to help them to sustain themselves going forward. So as we move from response into recovery, we'll be going back to all of those groups, asking them whether they want to continue if they've started up specifically for this. Whether they do or not, there'll be support. So if the group wants to cease but individuals want to carry on, we'll work out a way of being able to retain those individuals as well. We're also currently developing an app called Help My Street, which we will be able to deploy in future emergencies and to recruit volunteers for events, etc. as well. So there's quite a lot of development in that area, and I think what I would just say is that it has been an absolutely phenomenal response that we've had from communities. It's been absolutely brilliant.
That's fantastic news. That's excellent. Very, very encouraging. Thank you very much. That's brilliant. Thank you, Chairman.
Yeah, no, I mean, while you're there, Samantha, the trouble is with actually the community is, and I've just got involved in one of my communities, and basically they've got a village hall, and then they've actually got another building, a community centre. And the problem is somebody has to take ownership and run those community centres, which either falls on the parish council or it falls on someone. And it then gets quite difficult because someone, in effect, you might say let's say, the Dementia Cafe wants to set up in the village hall. Well, it's all right if the structure's running right, because you can actually go, you can say, right, I'll have that time slot, I'll run it, and actually all you've got to do. It's when you then take a whole community centre and you need somebody technically to run it, that it then gets complicated, and that actually becomes the biggest blocker for half the things to really get going. And I don't know how we sort of get round that, because I've sort of got And they're like, right, can you get involved? And I'm like, well, actually, hold on, who's going to take on this really to start with? Someone has to run the asset. And actually, it's if you get that bit done, the next bit can be sort of, it can get going. But often they do need a bit of a kickstart, because how then do you let everyone else know in the village, apart from do a drop? And it's actually, so the reason why we don't kick off as well as we do, it's the practical implications of some of these things that actually are more the barriers than really the volunteer work. People don't mind volunteering, but when they suddenly have to become the manager as well, becomes the issues. And yeah, I was an NHS volunteer, and in the end I came off it because they pestered me to death, and it was like I couldn't cope with it in the end. The phone, it was just, they wouldn't, no, you couldn't report it back to how it needed to be modified. And in the end, you had to resign off it because it was like the thing was bleeping all the time and actually nobody needed help. And then you get caught in 20-minute phone conversations, and I'm like, I've got to work. But I think that's the feedback is essential with voluntary organisations, and somebody has to take a bit of a thing. And I think LCC has a role to play, and it really is defining how you do that community engagement role. And I'm not talking necessarily all online, outside on those facilities where, because you know what, going to see someone and actually you can really see so much. You walk into their house, you know instantly what state everything is going on in their lives once you're in their house. A phone call doesn't ever reveal that element, and it is, once you get into it, it's quite fascinating. And I don't necessarily have the answers, but my God, you can absorb time trying to figure it out. Right, best get back onto the thing. Derek, I see your hand's gone up and down. You perhaps want to come in at the end still, I know, but anybody else? Do you want to say anything now, or move on to the next speaker and get a flavour? Because I've got Councillor Marianne Overton and then Councillor Rob Folkes.
Thank you very much for the support, Derek. We've had Kekoli Chowdhury in helping our COVID groups. We have a sort of joint group of the 12 COVID groups in my area. And also it's been a very useful way to actually bring extra funding in and so on as well. So that's been useful for some extra
Okay, I think Marianne's hit connection problem, so I'll move on to Councillor Rob Folkes and we go back to Marianne when she comes back.
Thanks, Hugo. It's just on this theme of sharing, and I've just been looking at the Lincolnshire County Council YouTube channel has 710 subscribers, which is not a huge amount when you consider the population in Lincolnshire. And one of the playlists is a children's health from 0 to 19, which is really good. But on the parental wellbeing video, which is a really good video, by the way, there was only 33 views. But it seems to me that we could make far more use of YouTube. But that means, of course, telling people, you know, where it is. So on social media and whatnot, to put links into these YouTube videos and to make more of them, explain things to people. Because it's so much easier to have someone telling you than having to read through the council's website, you know, which is a lot of the time quite difficult to understand. Thanks.
You're right. It's like information overload everywhere. And in the end, actually, you can't find what you want because there's every other information. And at the minute, you know, I agree with you, Rob. But my God, getting through everyone trying to tell you about COVID on their own company profiles, it's like, I've heard it all the time. I just want information.
Yeah.
So, okay, Derek, welcome.
Thank you, Councillor Marfley. Just to say a couple of things. Firstly, just to give scrutiny assurance that mental health and well-being is a key priority. It was before, but it's a key priority for us in terms of our COVID recovery work. So it's one of the key areas that we're working with colleagues in the Mental Health Trust, wider NHS, and we will be doing a lot of work at a Lincolnshire level, and all of the conversations that we've had is great because we can tie in councillor engagement and interest in this area to make sure that we focus on the mental well-being of people coming out of COVID. Part of that will be about physical well-being, physical activity, which is not an insignificant segue into Andy and our integrated lifestyle service in a minute, but that will be one area of it, but there's also quite a lot of work that we're doing more broadly. So really happy to come back to scrutiny in the summer as we develop those plans for coming out of COVID and taking some of the positives that some people have got, not just the negatives. So that's the first thing to say. We'll probably be looking at three broad areas. One will be children, young people and families. One will be working age adults. One will be older adults, because it will segment that way and it'll be different approaches for different groups. And then the only other thing I wanted to say is a personal thanks to Shab, actually, for doing what has been an exceptional job in this area. The wider public health team have all been doing a fantastic job, and it's nice for me to get a chance to put that on record. Some of us snowed under in COVID, others stepping into really important roles to keep this show on the road and keep delivering really, really important services and developments in areas like mental health, and Shab's been instrumental in that. So I just wanted to put my thanks on record at scrutiny to Shab for stepping up and doing such a fantastic job.
Yeah, excellent. No, it's I think it's very high on the agenda now, but I also think it needs to be high up there, because in the world we live in of complications and the complicationness of life, it certainly leaves people in all sorts of areas. I think the community engagement is an interesting one, and I think I would hope that the next session picks it up a bit more and sees, because actually councillors do a lot with community engagement. Officers are trying to sort of really engage, but actually there are barriers and obstacles, and it's a real hard nut to crack, so to speak. And I think in some sense, the one I've got involved with, it's like, actually, LC, it's like, well, what happens if they don't take it? Well, LCC will run it. And I'm like, well, actually, I'd nearly let them do it, because actually I'm quite interested to see how they're going to sort of set it all up as well. And it is that who's going to take it on. And I do think that, yeah, we can do a lot digitally, and also, but some people need their hand holding and actually walk through. And it's going to be certainly something to go forward. But yeah, great work, great start, and there'll be more to follow. So nice one, thank you. So
thank you.
Okay.
Bye.
Thank you very much. Thank you. So okay, we'll go on to number 8. Integrated Lifestyle Service 1U Lincolnshire. So welcome, Derek Ward, Director of Public Health, Rachel West, Contract Manager, Dan Rogers, Head of Service, Thrive Tribe, and Andy Emerson, Head of Service Delivery, Thrive Tribe. Good old tongue twisters in there. But yes, you just also got to remember that for those listening, if I don't read everybody's names out in the appropriate way and everything, it's all right. I've sat here and seeing it and reading it. So welcome all of you. Who's taking this away?
Thank you, Chair. I'll just do a couple of introductory remarks. The purpose of the paper really is just to update scrutiny on delivery of 1U Lincolnshire, our integrated lifestyle service, in light of COVID-19 and the response to that, and also in terms of the contract delivery. So that's where I'll pass over to my betters like Rachel, who will be able to do the details on that. I think just in terms of reminding scrutiny, it was your real support for this model that helped us get it over the line and get it up and running. And of course, just as we were starting to get into our pace, COVID-19 came along and has not tripped tripped us up, but has meant a different service delivery model, which I know Rachel and Andy and Phil will talk about. I really see One New Lincolnshire and also some of our work with the County Sports Partnership to be one of the key ways that we can come out of COVID and build on some of the positives. Lots of people who have maybe had to work from home are taking more physical activity, are taking a walk in the day because they've got more flexibility about their time. It's really important we build on that. But equally, a lot of people will have become even more sedentary for lots of different reasons. And we know that being sedentary is possibly as bad as smoking. So we'll have a real challenge for those people who've maybe gone backwards to get them moving again. And again, I think One New Lincolnshire, delivered by Thrive Tribe and other models, are going to be absolutely fundamental to making sure we come out of this and take what little there is positive from COVID and put it forward. That's all I'm going to say. Rachel, shall I pass over to you to take everybody through it from there? Thanks.
Yeah, thanks, Derek. Good morning, everybody. So my name is Rachel West. I work for the Commercial Team People Services, and we contract manage the Integrated Lifestyle Service, and obviously work very closely with the colleagues that you'll hear from shortly. The paper that's with the pack is a performance report that we did at the end of the first year of service delivery. It's quite normal practice for us to do this at the end of the first year of service. What I would say in terms of what you'll see in the paper, and obviously it's quite a detailed look into each of the elements of the service, which you'll be grateful I won't go into all of that detail now. I would say in terms of the first year of the delivery, this service was tracking what we would have expected a service of this newness in terms of some of the newer elements of this service that were put in from the start date from July 2019. So this runs from sort of the July 2019 into June 2020, which was the first year of delivery. First 6 months of this contract, as we would expect with any newly delivering, mobilising contract, was when all the mechanisms were being put in place, the pathways were being worked on, subcontractor relationships were being confirmed and formalised. So those first 6 months, as you can see from all the data within the paper, we were following a normal trajectory that we would expect with a service in a mobilisation period and transition. What we also saw was that after 6 months, when we were starting to see the fruits of all the hard work that was being delivered by the service, COVID came. And COVID had a massive impact on this service. And I think we've described it as the sort of triple whammy effect. So if you think of the impact on this particular model, so one was the referral pathway. One of the main referral pathways for this programme was always meant to be through the professional referral pathway route, through professionals in health. Obviously, COVID coming along has significantly impacted their ability to, one, focus on those referral mechanisms because of obviously the main work that they were all working on. There had been some starting to see some real improvements in that engagement with those health colleagues. So as that momentum was just starting to develop, COVID came along and obviously it massively impacted that referral mechanism. So I think one of the real strengths that we did in working with public health colleagues and with the provider was to look at how can we flex our referral pathway during COVID to make sure that we were maximising the capacity usage of the service, but also those people that could benefit from it during COVID, which is why you'll see in the paper we looked at modifying the self-referral pathway to allow all individuals to be able to self-refer into this for this limited period of time, and we will keep modifying it and reviewing that as this year goes on. The other impact that it had, if you think of referral pathway as one strand, delivery mechanism. COVID massively impacted on the delivery mechanism of this service. You know, they're delivered in leisure centres, they closed. They're delivered in group, where groups got together. Remember, this service is focused on people with long-term conditions who, again, most impacted and most suggested that they should be not engaging in these group activities or going into the settings that this service was set up to deliver. And that was the third impact, was on the service user group that this service was specifically designed to support. So I think of all the services that we manage within our team at the moment, this was the one that really had COVID impacts from all angles. But I would equally say it was one of the ones that adapted very swiftly in terms of being able to shift their delivery model onto a much more remote mechanism, and looking at how they could fast track the other room project that you'll have seen in the paper, which I'm sure was something that we were looking at doing anyway, but I think the speed that we asked them to speed that up probably gave them a few late nights. So they did manage to mobilise that really quickly, and that has been really successful. So in terms of the impact that we've seen, the report absolutely looks at, the projections that we made at the start. And we would have expected that to slowly increase during the year. And that was the trajectory this contract, in terms of how we managed it, was following until COVID. So in terms of the summary of the paper from a contractual point of view, we are continuing to work with the provider on a daily basis, really, throughout COVID, and much more now in terms of what does recovery look like. And I think I would echo Derek's points around this service. Actually, if you look at it now with the service user group, it's actually one of those opportunities that we've got, and certainly with the way that the service has adapted, we're very confident will continue to adapt and work with us in whatever the recovery phase looks like, so that we can work together to adapt the contract as is needed to fit that, adapt the targets as is needed to reflect where we are now. So in terms of from a contract management perspective, we are very happy with the performance of this provider, given the context in which this service is delivered in its first year and the way that it responded to COVID. And we will continue to work with them to look at where does this take us next, and what are appropriate targets, given the impacts that it's had on this service on those three elements. So they're the key points that I wanted to raise in terms of the paper. But happy, once colleagues from Thrive Tribe have had an opportunity to speak to you, that I'll happily include any other questions that anybody's got.
Excellent. You're on silent.
Yeah, just bringing up the share screen. Has everybody got that?
We have done, yeah.
Excellent. So good morning, everybody. I'm Dan Rogers, Head of Service at Lincolnshire. I'm here today with Andy Emerson, who's the Head of Service Delivery for Thrive Tribe. And we're just going to spend a few minutes reviewing the first year of activity for the Integrated Healthy Lifestyle Service. Thank you there, Rachel, for the introduction. Certainly the first year was not exactly as we expected it to be, but we would have to say that the relationship with LTC and the support that we've had has been fantastic, and has really allowed us to do some of the adaptations and innovations that you're going to see this morning. What we've attempted to do here is just sort of visualise really that report for those in the room. And we can see here that the first year of delivery saw a successful mobilisation period. We had strong referral rates at the start of the year, and clearly there was then a significant impact that affected us all in the form of COVID-19 from March. Despite the period of mobilisation and the lower level of referrals that we had from March, we were really encouraged actually that we still received over 8,000 referrals. And we've been delighted with the efforts of the One New Lincolnshire team. They've really shown incredible resilience, innovation and adaptability to keep all of our pathways open and to continue to support those most vulnerable clients across Lincolnshire, many of who have struggled with isolation and worry in what has been a pretty rotten year from March onwards. So very briefly, just to go through kind of that timeline, we launched in July of 2019. We had a really impressive recruitment effort. So 40 members of staff joined the service from all parts of the county. The team have excellent experience and expertise in health and wellbeing, and the sharing of these skills and networks across our integrated pathways has been invaluable. Q2 was used to train and induct staff, create the resources, source clinic locations, all the sort of things that Rachel has mentioned, in order for us to begin delivery as soon as possible. And by Q3, we were delivering. Q3 saw our referral generation team raising awareness of the service and referral mechanisms with colleagues in primary and secondary care, while service delivery continued well with 2-peat smoking cessation staff and our first sessions across our other 3 pathways. Having that smoking cessation team that were able to come in and just continue their delivery had previously been Quit 51, again was an invaluable resource for us to hit the ground running. As we got into Q4, we were really excited, actually. We had some really fantastic numbers. We had over 3,000 people that joined the service. We were at run rate for several of our pathways. In fact, as you can see on the slide here, from the smoking perspective, nearly 1,500 quits with a quit rate of above 50%. And also, we were starting with our Man v Fat football leagues. So these are quite innovative weight management courses, proven really popular with traditionally hard to reach demographic of males looking to lose weight. The traditional offers of the Slimming World, the WW groups, never fully appealed to all men. And having something that's a little bit more challenge focused has really appealed to the men within our service. We had those running across the county, Boston, Skegness, Lincoln, again really encouraged by the numbers and the starts rates that we were getting there. Of course, then Q1 came, and for us, it saw drastic changes to the service from the middle of March. So with the lockdown restrictions, our key subcontracted partners in Slimming World and WW had to close their doors. This limited a large aspect of weight management delivery. We also saw the leisure centres, as Rachel mentioned, having to close their doors. This restricted the referral routes for our physical activity pathway. And then with primary and secondary care focus clearly having to realign through the COVID effort, delivery of the smoking cessation through the GP and pharmacy staff had to stop. And this put an increased reliance on our core smoking team, that's only 11 people, to continue to deliver that remotely. Again, with visits to GPs down, and understandably so, the referral routes followed a similar path, and the remainder of Q4, as we'll see in some statistics in just a second, did slow down. So looking into that first year, we can see that the highest area for referral has been the East Coast. Our contract states that 50% of the contract needs to be delivered to the 30% most deprived areas of Lincolnshire. So this is by design, the numbers that you're seeing here. Also, the majority of our service, you can see over 50% of the age demographic is for 45 plus. So that's aligned really well with at-risk groups for COVID. And actually, we've seen over 400 people who were shielding during the latter part of last year. Which really highlights the strength of the partnerships actually between colleagues at LCC and the CCG, because we've been able to drive awareness of those challenges and those channels to get people in. We can see the split between male and female is sort of more tilted towards female, with the limitations to our male focused lose weight innovations, as I previously mentioned. We've seen a high proportion of females. That's not uncommon in health services. In terms of the balance of referrals, as we can see here, almost half of the referrals we received in year one were from primary care, with a majority of secondary care referrals coming from maternity services into our smoking and pregnancy pathway. And the self-referrals that you can see there were predominantly the smokers. As again, Rachel mentioned earlier, from July onwards, we've been able to become self-referral to all of our pathways. The year that we're looking at here would just see smokers able to self-refer. And so to actually see those numbers in action, we can see that from the start, the blue is year one, my excitement at year two that we're going to touch on briefly in this meeting. So from July, that a bit of a gradual rise as we started to roll out mobilisation. That was coming on quite nicely. We saw then the usual lull that you get around Christmas. There's not that many people on Christmas Day that are looking to sign up, but hopefully in January we see them encouraged to do so. And with the campaigns that we ran, we saw a really wonderful uptake there in January, and we're sort of running at run rate, as we mentioned before. Unfortunately, no prizes for guessing where COVID hit. Here we have mid-March, and the drop-off was quite dramatic. And you can see there's quite a slow recovery there as we were able to start moving our service remotely, supporting partners where possible and key stakeholders to take more of that delivery from our own core team. And I thought it was just important here to have a look into year two to show the sort of referral numbers that we're getting now. really encouraging for us is that still 70% of these self-referrals and referrals still from GPs and secondary care as well that we're receiving, over 70% still are presenting with long-term health conditions. So the elements of the contract that were so key to us all in delivering that are still being upheld very much throughout this. In terms of the referral pathways, as we would expect, the Go Smoke Free pathway saw the most in year one. As we mentioned, it was 2P'd. It continued to run in that first 6 months of mobilisation and continued to be self-referral in the 3 months from March to June as well. So really strong numbers coming through that service. The other elements are around about the breakdown that we wanted to see from the contract. The exception to that would be the drink less pathway, and my colleague Andy is going to speak a little bit about that and some of the challenge that we've seen from drink less and some of the ways that we think we can support in driving awareness and screening better into year 2 and beyond for that pathway. In terms of our COVID response, as I've mentioned, we've been delighted to say that all of our pathways have remained open. As you can see, one of our members of the team there working from home, on the phone, on the Zoom chats that we're all very familiar with by now. And their adaptability in this has been marvellous. We can see that our NRT, our nicotine replacement therapy, is delivered to the door. We were able very early to set up an agreement with Royal Mail that saw them come and collect all of that nicotine replacement that we were sending out to clients from our office location in Lincoln. So our core team across the county were able to have phone or Zoom meetings with those wanting to stop smoking, take down the order of what they need in order to support that journey, and then that was sent out to them the next day. So we were able to do that almost overnight. We had a seamless transition, which we were really, really happy with. And in fact, we've had 2,500 quit attempts now with a success rate of over 60%, and we're delighted with that. One of the big challenges that we wanted to be sensitive to as well was offline support. We saw before that a high majority of our service looks at 60 plus, and for the majority of 60 plus, using technology isn't a problem. There are still some that aren't using technology to the amount that we wanted to put into the service. So having offline support, making sure that we had telephone routes, making sure that we used traditional resources to set physical activity challenges, to feed back to clients and to continue that engagement was absolutely key to us, and it's really helped us to keep engaged with our population. In terms of, again, that COVID response, Rachel mentioned at the start, probably fast forwarded us, Rachel, about 18 months from where we wanted to be, but delighted that we were able to bring in the other room, which you can see here. Now, this is a physical activity website, and it's akin to the Joe Wick experience. So we have from across Thrive Tribe, actually, not just from across Lincolnshire, physical activity coaches that do daily live classes. And we do everything here, from chair-based mobility to yoga, beginner exercises, all the way through to the sweat room for those that are a little bit more advanced. And people can move through those difficulties in sessions. Those sessions are recorded, so clients are able, if they have a particular favourite instructor that they want to continue to work with, or if they've missed a session, they're able to act, and we're able to then see from what area of the country people have been accessing these courses to give them that support. And it's been a fantastic resource for us. We've had it's actually over 1,000 now since originally writing this. We've had over 1,000 people that have accessed this service. And actually this was identified as emerging best practice by Public Health England in a study relating to maintaining engagement in activity throughout restricted periods in COVID. So we're so proud of the efforts and the results we've been getting from this. I'm going to hand over to my colleague Andy now, who's going to talk about some of the challenges in year one.
Thanks, Dan. Great summary of year one and the COVID period. I'm going to take the next couple of slides just to give you a breather, really. It's been fair to say that beyond the changes that COVID-19 has presented, there's been other notable challenges that, if we address, will assist future outcomes for the programme. The link between NHS health checks and 1U Lincolnshire needs improving. There are over 207,000 Lincolnshire residents eligible for an NHS health check, 40,000 of which are invited each year. So there's such an opportunity here for this cohort of residents to benefit from healthcare professionals and One New Lincolnshire to improve this pathway. We think the solution is relatively simple. We're working with commissioners at the moment. The newly commissioned Lincolnshire County Council health check software system, when launched, should ease this process greatly, which will enable One New Lincolnshire to build better partnerships with all point of care testing partners and increase the referrals of the highest risk residents being referred to our programme. The NHS optimisation policy pathway needs to be formed. It's part of the specification for the contract. Primary and secondary care partners have had to forego huge prioritisation changes over the last year or so, which has meant that the pathway designed to help people lose weight prior to having an operation is not operational. The solution is One New Lincolnshire, Public Health Commissioners and CCG partners should soon meet to agree a pathway that can be launched when the peaks and pressures of the pandemic subside so that we can really launch this pathway. Referrals to the service for alcohol intervention has been low. Rachel and Dan has focused on that. External identification of people with mid or high alcohol dependency hasn't been great, and therefore referrals have been low to the programme for this intervention. The solution we have in mind has already been mentioned a couple of times, but I'll just reiterate it a little. We can offer a much larger screening programme alongside very brief advice for One New Lincolnshire clients relating to alcohol consumption. This will increase the accuracy of information relating to alcohol consumption and introduce prevention measures and increase referrals to clinical interventions for those most in need through appropriate signposting. So we can really shine a greater light upon this area, we think. GP referrals have slowed due to the effects and the priorities of COVID. Dan's been through that and articulated that really well. The solution is actually already in place. Dan has spoken about the increase in recent referrals. The revised eligibility criteria have been agreed. It's operational and it's maintained the focus on those with long-term health conditions accessing the service. It's working. We're really confident that the numbers of people that we're seeing coming into the programme at the moment are really encouraging. Dan, would you change your slide? Thanks. So bearing in mind those points, the next steps are already in place. Evolution of targets is already underway. Initial meeting to review those KPIs to suit the local needs has taken place and is being reviewed by commissioners. We're awaiting sanction on those aims now, so we're in dialogue at the moment. Greater focus on alcohol screening, fruit and veg consumption, pregnant and older residents is a key aspect of those targets that we're talking about. We'll be focusing on health in pregnancy much more. We've recently put into place a dedicated position aimed at improving health in pregnancy across Lincolnshire. It showed that role will have a greater focus on smoking in pregnancy to improve Lincolnshire smoking at time of delivery rates, and a new focus on maintaining a healthy weight in pregnancy through doing some low-level physical activities during pregnancy is the focus of that role. We are looking at, again, focusing on physical activity and looking to increase community provision. A new physical activity-based community offer is now available, which provides discretionary funding to support residents who want to partake in physical activity but have got a barrier in the way. The things that people can access are purchase equipment. They can get access to short-term gym and club membership, childcare to allow new parents to be active, all focused in areas of high deprivation. So targeted support to communities that we've rolled out. And finally, I want to focus on an increased focus on the older population. We're currently working with commissioners to flesh out how we can be more impactful with the older population within Lincolnshire. Our referral generation team are looking at ways of increasing uptake for the service with this target group. We're working with local groups such as Dementia Support to focus on vascular dementia, to understand more in depth about the role we can play, as well as offering the existing pathways that Dan's spoken about: go smoke free, eat well, move more and drink less. We aim to offer this group new options such as falls prevention using our online gym, The Other Room. As I've said, we are discussing this with commissioners at present, and we're fleshing out the potential of a dedicated post on health in pregnancy. I'm going to hand you back to Dan, who's going to talk you through some notable milestones and give you a chance to hear from some of our clients.
Thanks, Andy. We're just wrapping up really here. I think, as Derek mentioned earlier, really important throughout this time to actually highlight some of the positive as well, because yes, there has been significant challenge in year one, but there's been significant success as well. And just looking at this infographic, we've had over 2,000 quitters in the year. We've moved up 16 places from 72 to 56 on the NHS digital ladder for quitters per 100,000 population. We've had 1,300 people that have lost weight. It's actually an accumulated 7 tonnes of body weight of Lincolnshire residents that's been lost in the year, the equivalent of 2 hippopotamuses. I thought it would be quite interesting to put in there. Our biggest loser lost 33 kilograms of body weight. From our Move More pathway, over 2,000 people have increased their physical activity. That's a combined increase in moderate physical activity of 150,000 minutes, almost 2 laps jogging the diameter of the earth. Our health coaches have been phenomenal in supporting those with low confidence, motivation and behaviour change. I mentioned at the start the needs that those have had with some of the social isolation that's been experienced, and having a caring voice that's been there to empathise, support and empower to get into these sort of services has been really quite powerful for all of us. The staff's a happy, engaged team. From the start of the service, we've maintained 98% of that staff team. And we're really excited to announce that our evaluation project with the University of Lincoln has been granted ethics approval. We'll be looking over the next 2 years at the impact that integrated healthy lifestyle services have upon populations. And we're going to be a line leader in the country for that. So you've heard enough from me. Just a couple of quick testimonials here from clients, just to get an idea of what it's like within One U Lincolnshire. I'll just make sure that you can hear this. And if you can just give me a yes when you hear the audio, that would be lovely.
Yeah, that's fine, Dan.
A few phone calls in the initial period, and I've been asked to submit a week's worth of a food diary and that kind of thing, and then I moved on to the groups that you run, so where we kind of had some education and did some exercise as well. I guess my main goal was to lose weight, and I've managed to do that. I think I've lost 21 pounds. So I'm really pleased with that. Obviously, I've got a long way to go, but it's definitely kind of started me up, and I feel it's really achievable. I have learned lots from the sessions, and I am applying that to the decisions that I make when I go supermarket shopping, etc. Found it, like I said, really inclusive. There was a group, specifically the group, and there was lots of different abilities and lots of different ages and information and that kind of thing, but the support that was given was brilliant, and it was great to see the progress of other people as well, not just yourself. I could see in those initial weeks when you had people, they could hardly move their arms, and then they went from that to standing up and taking part in the exercise sessions. It was fantastic. It's a brilliant service, and it's what's needed. Just sticking to old ways of working, putting posters up and handing out leaflets. It's not enough for people. It's really tough to make changes, and people feel really lost. So the support that you've been that you've given people is fantastic. It's a really great service.
That's Victoria, and then just a very brief one from Terry here.
How have you found our one-to-one sessions?
Motivating, I think one has got to say, because in terms, it's given me a little bit of a discipline, a daily discipline, and I think I've got to do my exercises, and of course I have been getting the benefit from it. When we first met, I mentioned to you when you said, well, what is it you're trying to achieve? I said, well, look, I do have an issue with trying to put my socks on without going through the eye of a needle. That was one issue. And the other thing was of picking things up off the floor. If in fact I was in the garage and I dropped something, I would say to myself, I'm not picking that up until I've dropped 2 or 3 others. Then when I get down to pick them up, I'll really have a sweep at it and pick them up. Now, I don't have anything. If it's dropped, I won't think much about it. I'll pick down, go down and pick it up. But the big benefit has been the socks. So thank you very much for that.
Oh, we do love Terry. That does make me laugh. So hopefully that gives a little bit of an insight. In fact, we got Terry some One You Lincolnshire branded socks after he'd done that video for us. So that's it from us. We'd like to open that up to any questions now.
Excellent, and thank you for that. I think, yeah, I mean, it's one of the headaches. It's always been our performance in this area, and then you get the sort of green light go ahead, and then COVID sort of shuts you down, and well, it doesn't shut you down, but you know, I think you've seen sort of great resilience, and it is essential. I actually wonder whether really weight should become more a priority focus. And I think maybe you're going forward, your over 60s actually is where people start to wake up and think, I perhaps ought to get myself in better shape for retirement. But yeah, I think weight is still a big issue. Eating and exercise lend themselves into that whole criteria. I still think there's issues about nutrition, and I don't know whether you can put anything up on your website, but I think there's been so much conflicting evidence with food and what's good for you and what isn't, that actually in the end people have lost really the reality of what actually is going on in food. In fact, I saw a survey the other day that something like 70% of people didn't really know what processed food meant now. And actually processed food, real processed food, where it's like mechanically shaped, is actually perhaps one of the worst foods you can eat in terms of dietary and health. And we'll stick, and that's the likes of burgers and all that sort of mince, and everything's chopped up, chucked in and processed, and you know, like some chicken nuggets that you eat, well, actually there's no chicken breast in it. It might be, but it's all absolutely sort of reformed and shaped. And we don't, and if 70% don't know that, that's not helping to the whole nutrition of anything. But, you know, from my point of view, I think, you know, you have adapted well. The one thing I wasn't quite clear on, the NHS, are they being referring or not? It seemed a bit sort of vague on that. Primary care is referring, which is priority, and I suppose the question there is, are they referring enough? I suppose the problem is they're not seeing people like they used to either. NHS, I suppose really primary care is still the biggest referral potential, because NHS is often only about, you know, not, it's only when people actually go in for an operation or something that they, or see a consultant, would be the sort of thing there. So, but I'll let some of the others come in first. And I think we've got Councillor Christine Lawton first, and then followed by Councillor Rob Folkes.
Thank you, Chairman. First of all, I must apologise. I missed a good deal of this of this important element of our meeting. I was just disconnected, so I genuinely want to interrupt to say, if I disappear again, it is not. It's not for any sort of malign reason. It is that there are malign forces at work, and I was just disconnected, and it took ages to reconnect. So, and I do desperately hope it doesn't happen anymore. But if it does, my apologies in advance. But a fascinating subject, and I'm sorry I missed so much of it.
Thank you, Councillor Rob Folkes.
Thanks, Hugo. Just first of all, want to say to Dan, what a superb presentation that was. That was really, really good. And the quality of the slides and the infographics, cool. Have you set the bar high? That was excellent. You know, I mean, it was really, I thought, wow. Anyway, to move on, maybe Professor Ward could comment on this, but across healthy living, the importance of vitamin D. Now, David Davis MP raised this in Parliament only a couple of weeks ago, because it seems like, various specialists say that not only do we have a pandemic of COVID, but we also have a pandemic of insufficient vitamin D in the population. And especially during the winter months, from October through to March. And vitamin D seems to have all sorts of amazing benefits, particularly in bolstering the immune system. So is this something you're cognizant of to encourage amongst your programme altogether? Thanks.
Thanks, Councillor Folkes. The short answer is yes. There is NHS and NICE guidelines around vitamin D. I'll let Andy or Dan talk about one new links. I think the issue there is about, as Councillor Marfleet said, it's about a balanced diet. Because if you fill up your vitamin D area, but you don't get your vitamin C, then you'll have different issues. So it's a balanced plate, and at a population level, it's about understanding, and I agree with Councillor Marfleet, the evidence changes. There's lots of competing interest groups that want you to buy X product or Y product, and will play on that evidence. What we've got to get in Lincolnshire is an understanding of what a balanced plate looks like and how big that plate is, really. They're the two key things, as well as the physical activity component. Diet nutrition is always a challenge, always has been, always will be. Because it is quite a fundamental change, and that's why physical activity is often the thing that you can impact on quicker, but the two together need to be picked up. I don't know whether Dan or Andy wants to add.
Yeah, I'd probably add, Derek, that nutrition is a real big part of that. I think you focused on that really well there, but I think that getting the public back out as we ease out of COVID will be a major part of that. Walking groups that we will be reforming, outside groups within parks, etc., outside activity. Man v Fat will play part of that. So I think it's a combination of both, Derek, is what I would add.
And if I could just come in, just to also answer Councillor Marfleet's piece previously, in terms of that continued education, we do have blogs that go out. So we've got a really high following, which we've been able to really increase actually throughout COVID in terms of our social media presence, where we have blogs that go out regarding these sort of items, as well as newsletters for those that are within the service. And these are based, and we work closely with colleagues in Better Health, for example, to give messages in line with that. Things like vitamin D, particularly when we look at the age demographic that we work with, the risks for osteoporosis and the age groups is a big part of what we give out there in terms of brief advice.
I would agree. And I think portion control, like you said, Derek, your plate size is key. My lot go, but as I drum in and portion control, I hate wastage. Everyone's allocated X amount, and it's I think it drives the kids and everybody connected with me. They just go berserk on it. It's all he does is portion control. I'm like, well, it's halfway there. So, excellent. Right, I think Liz, you're next.
Thank you, Chair. We've had a message from you, Dan, about that the slides are on file. If you could just let me know what you mean by that, because I'd like to see them again, and obviously Councillor Lawton would. And just going to say, seeing the real case studies was wonderful. It really makes you realise it is about actual people. It's not just about numbers, it's actual people. And Terry, we all know Terry, don't we? And he was marvellous. And also, are you prepared for an explosion of demand? I think it could be me, one of them could be, having done a great deal less exercise during the winter and eaten more. So, yeah, wonderful. Really enjoyed that. I shall be using a lot of that in my other role because there's some really good stuff in there. Thanks very much.
Oh, thank you for that. Yes, absolutely. I will share the slides, and I picked up on Councillor Lawton's point earlier, and be delighted to share those slides so you've got them. Are we prepared? Yes, we are. What we've seen through that actually is that we've been able, by having our remote delivery, we're able to take on higher groups and resource to be able to support that. The key for us is a bit like you've said there, Councillor Sneed. It's about the individual. So we want people to work with a health coach, so they're getting a guided journey of support throughout the service. But as we look at our COVID recovery plan, we will have those subcontractors opening their doors again. So as Slimming World starts to open the doors, WW, our leisure centres, and we've all seen the 4-step plan, we're very excited to see that. That's going to naturally encourage those larger numbers to have areas of support. So we feel very able at the moment to adapt again to a different.
If I may, Chair, I would add to that as we come out of COVID, resident appetite for coming back to face-to-face delivery isn't really defined properly at the moment, so we need to be mindful of that. And I think for the short term, I think that we'll definitely have a hybrid in place, which will be a bit of face-to-face, but also maintaining the real brilliant aspects of the remote delivery that we've provided, so that we can offer both of those options, because, as I say, the appetite for face-to-face delivery is unproven at the moment.
In fact, actually, on that, I mean, I think one of the key areas, I mean, I've got into running, trying to get myself into fitter and shaper. The only problem is that, and we speak to people about this, and actually, we've come to the conclusion that actually when you get slightly older to sort of where I am, in some sense, you're not a teenager anymore that can leap out of bed and go and run 2 miles up the road. Well, most hopefully can. And actually, why we actually run is often because actually it's the way in which you stop little issues happening, which then stops you doing everything. You know, being fit gives you agility. And actually, and having said that, I can't do it at the minute because I go and I've actually sort of done something to one of my knee tendons, ironically. And I was just saying your thing there, because I was thinking this morning, I need to actually go another way now, because if I can't actually run, I need to do it. And I was thinking, actually, you're sort of like your Joe Wicks online type thing or whatever. Actually, that's a good thing, because it sort of means I can sit there and it's keeping the body moving. And as Ross Stewart says, if you keep it moving, it doesn't become a stagnant pond. And actually, your whole mental well-being and everything works better for you. And I think that's really the key thing. And it's not, not going out doing a 5-mile run, but it's just sort of having that agility and flexibility, which allows you, when the grandkids come or your kids come and they jump on you, you don't sort of go and pull your back just because you try to pick one of them up that you haven't done before. And but I think you are now really geared up to expand because of this COVID, and that is absolutely potentially one of your key things now. And I think, we do need to push it and support it. And I don't know if you've got a little banner on the LCC website, because in theory we should have that driving to, and even Business Lincolnshire. I mean, I've said it before in a previous item, but actually businesses do want to often help their people, and they don't know often where to go. And a little banner in there can help people, especially if the bosses are encouraging people and say, come on, you know, a bit more team effort with people, because it helps. So yeah, it's good. I've actually, before you come, Derek, I've just got I think Marianne Overton wanted to just sort of come in. So Marianne, if you want to just come in now, and then we'll let Derek sort of come back then.
That's very kind. Has Derek got an appointment? Has he got to rush?
Depends how long you're going to be, but hopefully not too
not long. Okay, I'm sort of coming up to the half hour. He might have a point. No, we're fine. Just to say a thank you, and I'm sorry I got cut off earlier. I had to move a different room, and the charger wasn't working. So sorry about that. I did want to say congratulations, and I appreciate the comments already being well made, but just to support those comments made, clearly a really good project, well presented and very successful despite the current situation. And I'm also interested in the expansion. You said self-referral just at the moment, but it does seem to me that this is something we should be really promoting, you know, we as individual councillors as well. And I think I'd love to encourage more people to get engaged. It's clearly excellent. The other thing that was interesting was the point about the group, the one lady where she was saying about the group, because one of the reasons I like group exercise is because you get that social camaraderie amongst the group as well. And I was afraid that might be missing from your presentation, but I think the person then said how much she'd enjoyed seeing the others succeed. So I guess you are managing to get those two things together. And yes, I'd love to promote it more. Thank you very much. And on the mental health one, I just wanted to say, Derek, well, again, very, very well done. But and the mental health first aid, I'm hoping that we'll be able to really do a lot on that. Thank you.
Excellent, thank you. Right, Derek, over to you then.
Thanks, Councillor Moffat. Just a few things just to wrap this up. I mean, the first is that it's been hugely challenging, and I just want to again pass on my thanks to Andy, Dan, and the wider team, including Phil and Sam, for keeping this going, and obviously Rachel as well. Really difficult, but we've kept it going as well as we can in what is a very, hopefully a once in a century pandemic. I think the second reflection from me is it's fantastic the scrutiny are so engaged and so keen, but we need to temper that by the fact that One U Lincolnshire are a commissioned service to deliver on certain things. And, the integrated lifestyle service was something I was really keen that we brought in. I think it's really important that we give One U Links and Dan and Andy a chance to deliver on what we actually commission and pay them to do in a normal world, or at least a new normal, as well as consider what we would potentially like to do wider. And clearly, in terms of the more intensive support, it is for a very specific subgroup of the people of Lincolnshire. It is not a general population level offer, although One U Links do have that via the website. That dedicated support is for a particular group. However, the flip side of that is, coming out of COVID and all of the conversations we've had, there may well be an opportunity to secure additional funding from central government sources as part of the COVID recovery. And then that might be an opportunity for us to look at what else could be done. But I think it's really important, and it's not like me to rain on somebody's parade, but we need to let One U Links deliver on what they're commissioned to deliver on, as well as consider where and how we can get more for the people of Lincolnshire, because this is quite a big change from what we had before. A scrutiny will be aware. If and when we can get more resources and we have capacity and people who could deliver on that, I think it is that opportunity of building on physical activity coming out of COVID. Not just that people have either been doing more or doing less, but I think genuinely the global population are aware that to be more fit and healthy is a good thing in terms of future diseases. So we need to pick up on that. Really big overlap with older adults in our county, because we've got an older adult population. And as Scrutiny know, we've got the Centre for Ageing Better now. We were successful in that bid, really strong overlap there about how do we help our 50 and 60-year-olds age well and age healthily, so that they have a much better quality of life in Lincolnshire, can continue to give back to the population and society, potentially continue to be employed, which is all good for them, but also minimises the impact on their ill health, on the NHS and on wider social care. That's going to be a key area that we want to look at as well. For children, young people, it's about when they go back to school, trying to get them re-engaged with physical activity if they've lost it. And that key transition, especially for girls as they move from primary to secondary and secondary onwards, are key areas that we'll want to look at. And as we go back to more of a mixed business as usual, so people aren't just working from home all the time, how do we get back to that active travel stuff? Because that's really important, not just for people's activity, but in terms of our CO emissions, our CO2 emissions, and making sure we minimise that and hit some of our targets. So there's loads and loads of overlaps here, not least in a different part of the service, smoking in pregnancy, which Dan, I think, covered. That's one of my key priorities over the next 12, 18 months. We have traditionally had poor outcomes and too many people who are still smoking in pregnancy, and that's a key focus, and we know we'll have a short-term real benefit to both the pregnant woman and to the baby when born. So there's loads and loads and loads of stuff, really good stuff. But point one, we really need to make sure One New Links can focus on delivering the service they're commissioned for, at the same time as developing and trying to find funding and support and options for expanding on that. So it was just that. It's not caution, but it's just realism that we need to focus on.
Yeah, no, I think, I mean, that's very true, Derek. I think really the key thing is making sure that all our partners and LCC in itself really pushes the sort of, to help push that One New as an option out there to people, isn't it? It's knowing that people that are, like you say, those that smoke, the pregnant girls that smoke, that actually they know about One Lincolnshire, and then the referrals kick in, and I suppose, and then at least once they're in, that we've got half a chance, well, 60% chance then at least at the minute. So yeah, it's hopefully well, everyone's doing their bit on that, and as I say, like websites, LCC, to sort of make sure that is pushed. Okay, Rob, I think. Rob, are you there?
Yeah, thanks very much. I just wanted to come back on the question of pregnant women. Are all pregnant women given information about this scheme? I know someone who's pregnant, who'd have a baby in July, and when I've been talking to them, they've never ever mentioned getting any information from anybody about the healthy sort of health and pregnancy scheme. I just wonder whether it came through midwives or should do. Just wondering about that. Thanks, Chairman.
Do you want me to take that, start off with that, Dan, and then you jump in?
I just saw Phil had raised his hand. I didn't know if he was coming in. I'm happy to take that. So the answer is yes, everybody is offered or should be by midwives. So those coming in, when they have a midwife appointment, they do a CO emission, so we supply the equipment currently. If that number comes up, a certain number, or if they declare themselves as a smoker, the ask from midwives at that point is that they refer into One New Lincolnshire. That's
sorry, I wasn't referring to a smoker. I just said general health in pregnancy. What is that included in the scheme? Sorry, this person's a non-smoker. Sorry about that.
Oh no, absolutely, yes, and that's brand new. So Andy sort of mentioned earlier on that we brought in a dedicated health in pregnancy role. So our physical activity offer is being designed now and will be rolled out from probably April, May time is when we're hoping to have an offer there for the county. So there is an existing offer for smoking, and there is one that's being delivered currently for physical activity and weight management.
Great. Thank you very much, Mr. Chairman. Thank you.
Okay. So I see Derek's got to, you've got to go and speak to our Chief Medical Officer, who actually I found out today lives in Boston. So, yeah, good old Lincolnshire. Born and bred. Well, certainly been there most of his life because he went to school in Boston. So, yeah, good news. Good things come out of Lincolnshire, I tell you. But, right, I've got Councillor Christine Lawton and then Mark Whittington.
Just a very quick, Jonathan Van Tam was on Sky News this morning. He was excellent, and he had Lincolnshire all at the back. He had a picture of Pilgrim Hospital in the back. He was absolutely ace, really was. On the question of smoking and pregnancy, while we were touching upon it, I remember centuries ago when I had my first child, we were almost encouraged to smoke because you had smaller babies. It just shows how the world has moved on since then. And I did smoke, and I did have a small baby, and she's lovely, but I'm still very sorry I smoked. One thing that never crops up, and this is going off piece as I usually do, we talk about physical health, we talk about mental health, we don't talk about the health of your brain. It seems to me nowadays we have completely forgotten that even as people get older, they still like mental stimulation. We've done away with the WEA, we've done away with evening classes, all those things that older people like to still feel they were capable of thinking and exercising their brain as well as their body. And I'm very sorry about that. And I think if we could bring back things like that, I think you would find isolation and loneliness were decreased quite considerably, because people do feel the lack of mental stimulation, and they sit and watch rubbish on television because or read books or whatever. But to go out and talk with other people about things that are intelligent, and you can learn things from. We should never stop learning, and I wish we would go back to doing some of those things.
Thank you for that. Thank you. Right, Mark.
Yes, thanks, Mr. Chairman. Not going to risk putting my video on. I've had a few connection problems this morning and have lost connection several times. I follow this with interest because obviously I've been on the committee for quite some time. I remember when this sort of scheme was being discussed in the committee. One thing that sort of does want to trace possibly is if you sort of got, so to say, slightly overweight people in later life to sort of get them remobilised, as it were, and start doing stuff. I was thinking a lot of those sort of people do have sort of issues with sort of arthritis and joint issues and things like that. I'm just wondering if as part of it maybe, because sometimes maybe all they need is a little bit of physiotherapy or whatever, just to get some of the sort of the muscles and joints working again. Just wondering if that is something that the team were considering as an option to help the more mature individuals get themselves moving again. Thanks, Mr. Chairman.
Thank you. And I think it's like, as Derek said, we must stay focused to start with and get results coming through from this. As we said, we've fought hard to get through to here, and it's right that we stay focused. And I think it's also right that they're here where we also want to go. But I think that, as Derek has alluded to, we really need to get sort of singing and dancing on the hymn sheet on this to start with. I've got Derek and Philip to come in.
It was just to say that clearly our links into NHS services, our occupational therapy services, and Sam will cover this as we go on to the next item, actually, Chair. But the adapting people to live in spaces as well as spaces to support people is going to be really important in our older adults. And some of that might be losing a little bit of weight and increasing your mobility, where One New Lincolnshire Thrive Tribe can support. Some of it might be a little bit more specialist, which is occupational therapy and potentially physiotherapy, and building a pathway. So for the individual who needs that support, doesn't matter who's providing it, they're getting the right sort of support in the right place at the right time. That's the key model. And as we'll be talking, I'm sure, in scrutiny in the future about the integrated care system, as we develop our integrated care systems, it shouldn't be about who's providing what bit. It should be about the pathway for people that keeps them physically active and able to stay in their own homes and live long and fulfilling lives. And I absolutely agree with the point about mental stimulation and emotional engagement. I think that's really important, and there's a big preventative part of that. I've just turned 50. I am, for my sins, learning the piano, because it is one of the evidence-based ways that you can help to keep your mobilisation in terms of your balance, but also in terms of create new neural pathways. And in my age band now, that's what I need to be doing. So as well as cardiovascular health, things like that can be done. Big aspect of this is just helping people in Lincolnshire understand the 2, 3, 4 things that they could do that would really keep them fit and healthy in sort of the 50 to 65-year-old group. And our comms approach is going to be really important over the next 6 months. If you don't mind, I'll dial out now just so I can get onto the scene.
And I'll just finally say on it that actually people have a responsibility to look after themselves and actually help themselves and do it. We shouldn't be always leading everybody. It is their responsibility to look after. I think people forget that at times. Right, Phil, you're sorted. Are you answered by Derek? Brilliant. Okay, right, well, that's been very good. We wish you well. Year 2's looking promising already. And I think, which is great news, I think you've learned some great lessons from COVID. You've come out of it well. Foot to the pedal, foot to the floor, pedal to the floor, rather. And yeah, let's get it to really shine. So well done, guys. Thanks very much for coming.
And thank you for your ongoing support. You've been tremendous through this rocky period. Thank you.
Yeah. All right. Cheers. Thank you.
Goodbye.
Thank you. Bye. Okay, we'll move on to Lincolnshire Homes for Independent Blueprint. So on this one, we've got Councillor Wendy Bokit, who has been the chairman of the Housing, Health and Care Delivery Group on this. Derek Ward, who has now left but has also been involved, but he will be supported by Samantha Neal, the Assistant Director of Prevention and Early Intervention, and Sean Johnson, Public Health Programme Manager. So let you take it away. Wendy, you going first?
Yeah, I'm going to go first. I won't keep you long because, my God, it's 1:45 and my tummy's rumbling. So.
Yeah, I know the feeling.
Right, so yeah, this paper, it's Lincolnshire Homes for Independence Blueprint that we're bringing through today. It's taken a long time getting to this place. We've been talking about it on Health and Housing Care Delivery Group for over a year. And it was actually a year last January, we had a workshop in Lincoln where we all sat around the table, districts, health, police, fire, you name it, CCGs, everyone was around that table, and we've worked from there to produce this paper. It's a paper that talks about houses for life, so that you can have a home, and if you don't want to move from that home, you shouldn't have to. But it also talks about lots of housing, supporting housing in the private sector, which are of low people in low incomes that are living in poor conditions across our districts. And this is a big thing across the districts at the moment that partners are looking at to implement. It also looks at about the government and their white paper that they're bringing out at the moment. We want to be involved in that, and this again brings it out in this Housing for Independence. We want to make these standards across our district, across Lincolnshire, so that our houses are for life, and that we change building regulations across the district. So developing this blueprint is a first step to agreeing across local government, social housing standards, district councils, health, the ageing better, the standards that we want to achieve through Lincolnshire. So we look forward to working together with all our partners to deliver this Housing for Independence. Samantha and I will be taking it around to all districts. We would like everyone to sign this off. This is why we're bringing it here today. You know, we're looking forward to taking that out, and so that a resident can have their forever home and be comfortable in their ageing life. So finally, I just want to thank Sean Johnson, Samantha Neal and Lisa Law, because it's been a long time coming, this paper has. It is really interesting. I hope you all read it and take the knowledge from there. So I shall pass over to Samantha.
Thank you very much, Councillor Bowkett. I think just a couple of things to note about where we're at the moment. So the copy of the document as you have it has yet to be fully formatted. That's with the comms team and the printers very soon. It's not something we're going to do a vast print run on, but we do just need to get the graphics, etc., just tidied up. But we didn't want to delay bringing it to you today. I think the second thing to say is that the going out to the districts and to partners is really important. I think we are making great strides in being able to talk not just to housing departments in district councils, but also the planning teams. And Councillor Bokett's done a fantastic job getting a real strong drive now from councillors through that housing, health and care delivery group. When it started off, it was very much officer-led. It's now very much a member-driven partnership, and that is really helpful. And then I think the third thing just to say is that in terms of the delivery plan, you have deliberately got a delivery plan that is not fully populated. This isn't a county council document. It's a partnership document. It's reported and monitored through the Housing, Health and Care Delivery Group, but on through there into the Health and Wellbeing Board. And obviously, as you'll be aware, that's where the integrated care system is also going to start to join in a much bigger way going forward. So there's some very clear governance around this, but the delivery plan itself will be populated in partnership with those organisations. And that will be part of the outcome from those meetings that Councillor Bowkett and I will have with district councils and others. This is about more than lip service. This is about everybody signing up and doing their part. And I think we're in a very different position now than we were probably 2 years ago, 3 years ago. There's a clear conversation in those meetings now that focuses on the person, that doesn't talk about which organisation should be doing which bit, that talks about the system. We've still got a way to go to make that reality across everything, but that's the direction of conversation that has changed over the last couple of years. So this, as we've said, this is going to Councillor Bradwell to sign off in her portfolio role, and this is to take any comments from yourselves that she needs to be aware of in taking that forward.
Excellent. Okay, well, I've got Councillor Christine Lawton to come in.
Thank you very much, Chairman. Wendy, we've just been talking about pregnancy in the previous issue, and this has certainly had a long gestation. I think longer than you could have a baby in the interim when we first started talking about this. This will undoubtedly bridge the gap between housing and health. The two are inextricable. I'm looking forward to taking this to South Holland District Council at our informal cabinet, and I'm confident that they will receive it very positively. We will utilise the blueprint in developing our local plans and planning design, and there will be nuances, of course, as each district and each area has its own particular problems and priorities. Perhaps as a stockholding authority, we may have something of a head start with our own housing company. We can ensure future-proofing of some of our properties. We have already made changes in our allocations policy, for instance, where we have adapted policies, adapted properties, so that normally the normal priorities, it would go to the next person, but we are changing that so that it will go then to the person who next needs those adaptations and those disabled facilities. So that's made a change already. So our first selection of an applicant will be suited to the property, not the priority, as it were, of the applicant. For example, now we've got new bungalows coming on stream, and we shall in future be making sure, I've spoken to strategic housing, that we get to work with developers to ensure things like electric sockets are at waist height, all those simple things that, quite frankly, we could have been doing years ago with people and didn't, but this will energise us to do with this. I think importantly, local authorities will have to work with local businesses and get them on board. For example, things like 0 hours contracts, which make a real difference to our homelessness, because once people, have no work, they suddenly can't afford their private rented housing, which are huge in South Holland. So that contributes to homelessness. We shall be working with them on that. So extra care, of course, we are we are struggling. South Holland is struggling with that, but this will energise us, hopefully, that we can make more progress on that. So, as I say, I'm looking forward to this, but and we will certainly utilise this document to for in our future plans. But planning is important, so we will have to make sure we work well with planning. But welcome this. Looking forward to taking it to South Holland and fully supportive of it. Thanks for all the hard work.
Thank you for that. Councillor Rob Kendrick.
I think everyone involved in this should be congratulated. It's great to see this brought forward. We always hear or often hear about sort of joined up thinking and working together, and this is actually a brilliant example of it being put into practice. It's marvellous to see this, and it may be the model for other places. But it's great to see it, and I wish it well. Thank you, Chairman.
Thank you. Yeah, I mean, it is a great document, and it's a great start, and it's what we're needing. And I think the more we roll out sort of extra care housing, etc., the better. I think some areas where we sort of struggle is like the private sector, and even looking at, and I've seen it on television, some of the appalling accommodation that people are living in. But I have to say, some of that is council owned, and in some sense, I think, when you sort of look at quality, it really does embrace a whole range of situations and how we sort of tackle that. I know people that rent houses out, and I know they get some sort of people, and they'll get somebody in, and it could be somebody that's been moved there because of domestic abuse, etc. Then the partner finds out, and then the place gets trashed, and there's legislation and all sorts of complications. And I think that's a sort of a beast. We can do our bit, isn't it, on how we keep sort of trying to design and build. And it's like I've always said, disabled facility grants, it's great if you put in a sort of a wet room. There's nothing more upsetting when you see somebody then take it out, and it's like losing the facilities that's gone in. And it's maybe, and I hope in the future that we get more sort of private landlords that sort of put these facilities in and then hold it for people that need that facility and market that facility. Because at the end of the day, the private sector is still a big player in the whole market, and we can do our bit. And I know it's like, I look at my house here, and reading the report, and you think, you know what, I would love to be here till you sort of ripe old age, but you also know that there's steps in and around it, and I live in the world's on a hillside, and some areas you've got it. But, we've got to make a start. We've got more to do, and it really is a great piece of work, and credit to Wendy and the team for sort of, trying to sort of encompass what really is a sort of a beast of a whole thing. And if you don't watch it, you start going off on various routes, and you can get distracted very easy on it. And but I think, as we've sort of just seen in adults, a sort of extra care housing coming, and those facilities as well for working age adults as well, which is, I think really good. And it's the only way we are going to do it is because actually the councils, the districts have got the planning rights and the planning permission. And I think some of it you do. I've gone round places and think, oh my God, that's shocking. Whichever age you live at, actually, you need to be fit and well, and all the sort of botchness that's gone on in society. And but yeah, without a doubt, efficient living is really the key, and especially for those that don't have great wages. I know when I was younger, I had an inefficient rented property, and you paid the price. It was just a drain. And the more we get into efficiencies and everything, I think you've done a great start, and I think it really is a good document. It needs to be all completely everyone buying in, and hopefully and it's one of these documents that doesn't want shelving, does it? It wants to be kept alive, living and evolving, and pick other bits off. So yeah, well done to everybody. And I don't know if anybody else has got Councillor Marianne Overton to sort of come back.
Thank you very much. I'm really pleased to see this piece of work. It's a tough old job, trying to make sure that the housing we've got is appropriate for the people who need it. And that means new build as well as retrofitting, I think, current building. So it's certainly a big old job. The planning is a difficult one, and because we have in our plans that houses should be built according to need. And we have in our plans that if there's a big estate, it should have a percentage of affordable housing. But actually getting it built is difficult. And indeed, you'll probably know in North Kesteven, we've just had some, perhaps I can't remember. Actually, I better not say I can't remember if it's on pink paper or not. But I think the issue is often that it is quite difficult for us to be able to get the affordable housing that we are expecting to have in place, and that's quite difficult in planning. And I would really like to see that strengthened. Also, it's a huge success. I think both the county and the district have got some really successful projects, which I would call flagship projects now, with the types of housing for people with adults with extra needs. And I think that's such a big step forward to see that in place. So I hope we can get more of that. The issue, though, is that it must have local councils at the key, I think, but also it can't be only the local councils. We do need the private sector to build what's needed locally, and that's why I'd be quite pleased to see the regulations tightened or altered so that we can have more housing with good insulation, for example, underfloor insulation as well, which seems to be often forgotten. So I think these are key points, retrofitting, and I think they're in there, but I'd just like any more comments about clarifying about how this document will actually take those things forward. Thank you.
Right. I've got Mark. Do you want to just come in and then Sam can wrap up?
Thanks, Mr. Chair. I think Councillor Overton made some very good points there regarding affordable houses and the ability of local authorities at district level to kind of enforce it through the planning system, because I certainly know that in the Grantham area, Grantham originally, part of SK, the target for affordable houses in Grantham was 33%, and then it got knocked down to 20% because a lot of the developers came back on sort of feasible, and they come back on this. Oh, it's on this feasibility ground. It's no longer feasible to do it if we have this portion of affordable houses. So I think district councils do need to do a bit of pushback on some of this, because obviously developers want to maximise their profits, and so maybe we do need a bit of a pushback. And of course, the question is, what we sort of may think of as affordable housing may to a lot of people on low incomes not be affordable at all. So I think district councils do have a role to play potentially as well with their social housing provision as well, and to make sure that I've been doing a bit of casework recently with one of my residents who has some quite substantial work done in her house, the installation of a lift and various bits and pieces, and the intention is to hopefully be able to keep her in her own home. And then of course, obviously, when she no longer needs the property, I think from my point of view, it would be crazy if South Kesteven then were to sort of take all this stuff out, because there may very well be another person whose needs who has similar needs. And I think that's the point I think the Councillor Lawton referred to as well, as making sure that don't necessarily give the house to the next person, but give it to the person who has the need on that. But just one final point, an awful lot of us, Wendy, as you know, are as well as being county councillors, we're also district councillors as well. So I'm sure if you sort of contact us all, we'll be more than willing, because I know the Council Lawton has said that they should push it forward through South Holland. I'm on South Kesteven, I know Councillor Kendrick's on North Kesteven, so it might be, if you contact some of us, we can maybe have a word with the with our colleagues who may be in a position to influence this. Thanks very much, Mr. Chairman.
Thank you. Liz?
Yes, it is only brief. I know you want to finish. But I just wanted to tie in some comments on page 44 from that very early paper we had, with some comments on here about the potential actually for a post-COVID opportunity using one public estate, that we could have buildings and land to spare that isn't going to be used now, and how it could tie in so well with this. The timing might be perfect, so that could be a really good thing to come out of COVID for us, that it will open no end of opportunities up for us, both new build and retrofitting. Thanks, that was all.
Thank you. Christine?
Thank you. On the, I've been on a planning committee for a good many years, on the dreaded thing about affordability and planning and developers, the awful word is viability. And that is being used more and more against us. The only answer, in my view, is to work in partnership, build up relationship of trust with developers and with private landlords. If we have built up some really good relationships with some of our, but the trouble is with the public, all developers have a bad name. All developers are in it for profit. They want to build rubbish houses, and they don't want to give public open space, all sorts of things. It's not true. If you build up a good relationship with developers, you will get good housing. It takes some doing, but viability for those who don't want to contribute to a fair, affordable rate is difficult for us. But we will get through this, and we will end up successfully operating this blueprint. We don't want it to be like previous memorandums of understanding that have been signed off, sat there and done nothing. I hope this is a living, breathing document that we will refer to, make considerable use of. Look forward to it. Thank you.
Yeah, I mean, I agree with everything you just said. I think the only thing you have to watch now is, unfortunately, I know we all sort of say about the developers, but actually, we are still, you can go to some areas and buy a house cheaper than what you can ever build a house. And I know we sort of talk about but actually to build a house today is really quite expensive. And actually the word affordable on a new house does sometimes become actually, because when even affordable is about making sure that it is efficient, access friendly, everything about it. And actually, unless you're building on a sort of a clean site, a greenfield site, and really sort of have that, what I call mixed housing in there, you really struggle to get your cost structure right, and you could take a sort of a plot of land in the middle of a village, chances are it's brownfield, and they've instantly got a cost trying to clean the site up before they even lay the first bricks. And that's, I suppose, in some sense, I'm not defending, but that's actually the reality, is that actually things do cost us money. I mean, and then what's deemed affordable. So, and I think that's where there is a point where I think your rental market has to come in, and good rental stock is really the solutions in some areas. But that's why it's a complicated beast.
Can I just come back quickly before Sam comes on? It is about just what Mark's just said about districts. We have had all districts sitting around this table. We've got every district and officers sitting around, so everybody's aware of it. And that's what I've said. It's about working together. It's about bringing this forward, and it's about members and officers working with all the planning and everybody else that goes with it, and help what they need for us to put things in our houses. And we've cracked it. Yes, it's not going to be easy. I'm not saying it is, but we've got this far, and I'm telling you, it's not been easy to get everybody to agree to this, but we are here and we are going to carry it on. Come May or not, if I'm not here, then someone else will carry it on, but we are going to do that. It's not just about affordable houses, it's about any house. That house has to have standard things in it. whether it's a £500,000 house or whether it's a £120,000 house. They have to have the same minimum standard, and that's where we're going. Thank you. And I'll just pass over to Sam now because I know time's marching. Thank you. But thank you for listening, everybody.
And I think that's the comment to really go forward from us here, is that this needs to be a live, evolving document.
Absolutely does, yeah.
So and keep it going. And you're right, Wendy. It's you know, to get everyone at the table and all the districts is a challenge in itself, because everybody's got different angles now. Some have sold off their stocks, some have kept theirs, some have got this, some have got that, but they all have planning permission to be granted. So I think the only thing we need to say is there anything that we do need to put in? And I think it really is that we support that. It's a great document. We love the fact that it's got partnership. We want to see it kept live and driven forward. And if anyone's got anything else to say on that, speak now.
Forever hold your peace.
Yeah. Okay. All right. Well, thank you both for that. And yeah, well done, Wendy, for all the hard work that you've put into this, and for Sam for your hard work in the lead. And I know working with all the districts is challenging, and you know, you've done a great job to get this far, and let's keep it going forward. So thank you all.
Excuse me, Chairman.
Hello.
This is Trina here. Obviously, this is going forward to the Executive Councillor, so we really need to, you know, if you look at the on your notes from Simon, we really need to take a vote on this. So we need a proposer and a seconder.
So all you councillors, put your screens on and hand up if you for. That's good. Brilliant. Thank you. Anyone abstaining or against?
Did we need a mover and seconder, Chairman?
You did, Chairman.
Yes,
you need a mover and a seconder.
Right. Who's propose? Proposer, please. Christine, thank you. Seconder. Liz, thank you.
Thank you. And I think Councillor Mrs. Overton's left, so everybody that's left,
so
we're all voting in favour. Thank you, Chairman. I appreciate that. Thank you.
Brilliant. Thank you. Okay, final one, work programme. Simon.
Yes, thank you, Chairman. If I could ask members of the committee to turn to page 195 in the agenda pack, that sets out the well, there are two items on the list for the next scheduled meeting on the 14th of April. I've had a message from Glenn Garrett that the first item on the list in relation to personal health budgets and direct payments will need more time and most likely wouldn't be ready for a meeting in April. So that's the list before the committee. I know that this meeting, and I should remind the committee that this meeting will be taking place in the pre-election period that begins on the 22nd of March. But I understand, Chairman, you're going to discuss with the committee whether the meeting should proceed on the 14th of April, or whether there are other options for the items there.
Okay, brilliant. That's on. Well, now that we've lost one item, then that only leaves one. In some sense, we could have a discussion about anything, but that would need to perhaps be more off record. I'm now tempted to say that actually, because it is in the election time and we're only down to one item, that can be picked up on the new session. And maybe actually, I think the best thing now to do is to perhaps cancel the meeting. What's anybody's views? Christine.
Well, just to say, Chairman, I should be very sorry if the meeting is cancelled, because it would be my last meeting since I'm not standing for county again. So I would be very sorry, but if that's the way it is, that's the way it is. So if this is the last meeting, goodbye, and it's been lovely working with you all. Thank you for your patience. Thank you very much.
Okay, anyone else views? I mean, the only other thing I did wonder is whether we should have a discussion about what we've done and put any recommendations forward. But, you know, while we're on the topic, so I've got Chris, you want to speak?
Thanks, Chair. Firstly, sorry, I've been having all sorts of trouble trying to get the things work. I still can't get my tablet working and the internet's been playing up as well. So apologies for joining very late. But yeah, what you just said there, I think it might be a good opportunity maybe to go over some of the stuff we've looked at during these last 4 years and, you know, just maybe bring an update on a few things and, you know, any of the stuff that, you know, we've said, oh, we'll have a look at that again later and, you know, just use it as an opportunity, just to tidy up a few things and, you know, maybe look at things that we could put forward for the first meeting of the new term, maybe.
Yeah, I mean, I'm quite happy for that. So what's anybody think? We have one item, so we can always leave it running on one and then have an informal discussion afterwards to just recap and put forward. If everybody...
Yeah, I like that.
Rob?
Yeah.
Rob?
Yeah, thanks, Chairman. I think as, you know, unlike a normal situation where people have to travel into county offices for a meeting, because this is a virtual meeting, you know, it's not costing a lot of people's time and effort to take part. So as you say, and as Councillor Reid has said, you know, a sort of recap overview type meeting, picking up on some of the points we've done over the last few years might be worth doing because we're not having to travel across the county in the case of some of our members south of the county, giving up a morning or whatever, travelling across for a couple of items would seem a little bit silly, but because we can do it remotely, I can't see there being a problem with it. Thanks, Chairman.
Okay. Yeah. Mark?
Yeah, I think I would tend to agree with the comments that Rob have made. Actually, you know, we could usefully have a discussion around what we've done over the last 4 years, and almost like the outgoing US president does, and well, not in the last.
State of the Union.
You're calling me Trump.
Leaves a letter just to say, well, you know, this is what we've done, and whatever. Maybe if we could just leave a note for whoever's coming in that this is what we've done, and these are the issues which we feel still need to be looked at.
There's no money left.
Simon.
Chairman, well, just to reiterate that we will perhaps need to be careful of the content of that item. I mean, one option could be for the 14th of April is whether an informal session to look at a perspective, if you wanted to look forward and leave suggestions for the work programme, whether an informal session might be an option for that day. But I just
Simon, it's like we said, I think the best thing is let's run it as a formal, do that the one item that's there because it going to have no impact on the election or anything else, and then we will have an informal one after that where we will then discuss and just summarise and wrap up the end of our 4-year period and, like say, hand over any notes, advice or what we deemed as maybe a good thing or priority. Yeah?
Yep, okay. Thank you.
All right. Right, well, thank you all for coming, and well, we will see you on April for the last.
There is no escape.
Have a good day. Thank you all. Thank you.